river system.
Panogitsa moru puritanonda kantai mantunat nyagitoru iluga.
GMH Administrator Lillian.
Ion para y gloria abiba islasen para.
University of Guam Dean of Nursing Margaret.
Ion para y gloria abiba islasen para.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Langit na bendisyon Kontray peligro na fansafuham Deus protege Islandwon
Out in the public, where all are more exposed.
Peligro na fansafuham
585 have tested positive.
Are you ready? Yep, air omen is still in effect. You know that you're... Good morning, Guam! Viva Betness! Betness! Yeah, it's Friday.
Thank goodness.
Yep.
That's why I'm not sleeping.
3-day weekend.
For some of us.
I mean, it's kind of been a 2-month weekend. Good morning, 622. It is the KUAM News takeover of Guam's favorite. Kicking it off with a little Jesse Bias. You know, this song hits different if you were actually alive when it first came out. Mm-hmm. This was the jet, right, Jay? Oh, yeah. Anyway, good morning. Wow. I'm just going to say, wow, I had a hard time sleeping last night after watching that oversight hearing. Did you guys watch the oversight hearing last night?
Me?
I know you did, yeah.
I watched most of it.
I don't even know what to say. And it's definitely going to be something that we talk about probably for the whole show. We got a few senators who sat in on that oversight hearing who asked questions, who tried to ask questions. And yeah, we'll go into it. Sabrina, I just think that, lawyers, there's all the jokes about their reputations. Yeah, it didn't get help any at all last night by the performance of the lawyers in the oversight hearing.
Most disappointing, the Attorney General's office.
Yeah, and, obviously, we have some pretty strong opinions about the way that oversight hearing went down from start to finish. And I think you guys need to be alarmed at the lack of impartiality, the lack of independence, the lack of the ability to really police the government of Guam from the Attorney General's office. That was just mind-boggling, how the Attorney General's representative really just ran blockage for the governor. I thought we elected an independent Attorney General. The last time I checked, we elected an independent Attorney General. I didn't know that we elected somebody who was going to, help the governor and the legal counsel get away with stuff and then, not talk about it to the people of Guam. I mean, if you really think about it, after that hearing, one of the thoughts I had was, wow, we are paying these guys a lot of money to hide stuff from us. Executive privilege? What is this? The movies? What? You guys said you're transparent. You guys said you were accountable. The governor in the press conference, it was just this week. He said, no, there is accountability in our administration. There's transparency. Oh, man. And to me, it just doesn't jive that you can go out and say these things and then do the complete opposite of what it takes to be transparent and expect nobody to to get it. You think, okay, so good morning. Okay, good morning.
Let's calm down. Let's calm down.
I know, we're just getting started
yeah.
here. Yeah, I know. Okay, 6:25. Yeah, so obviously that was
We need
just,
to get Claire Calvo in here to give us those meditation.
I need to get my purple aura back. Okay. Hey, the show's proudly brought to you by Ambrose Inc., IT&E, Coast 360, the Bank of Guam, and Calvo Enterprises. It is the KUAM News Takeover of Guam's favorite KUAM FM, Agatnia Guam, containing COVID. And there's so many ways to catch this multimedia broadcast extravaganza, of course, right here on the radio. We're on Docomo Channel 11, streaming live, KUAM.com, the KUAM News app, and last but not least, on the award-winning, totally legitimate KUAM News social media. Good morning to our Facebook Live viewers. Thank you guys so much. And let's get right to it. From the KUAM News team, with a dive into the day's COVID-19 headlines and then some. Good morning, Sabrina Salas Matanani.
Off it, everybody, and good morning. On Thursday, Public Health ran 24 samples, and all of them came up negative. This means the total number of confirmed cases of COVID-19 on Guam remains at 165, with 5 deaths and 125 recoveries. As for the recent 11 positive cases, they are from the same cluster from a neighborhood in Jigo, or actually 10 are, while the other new positive is not related. The 10 are asymptomatic but are believed to have come in contact with 2 previously positive cases and are now in isolation but are not hospitalized. Public Health Director Linda Pinko-Dunorsi did not provide any specifics about the 10 cases, such as if they may have been together at a gathering or at another event. The governor, meanwhile, has decided to delay the reopening of dine-in service at restaurants. Was it emergency procurement or emergency purchases? Who does the Attorney General's office represent, the people or the governor? Who's in charge during a public health emergency? The Public Health Authority, Linda Pinko-Dunorsi, or the governor? Who's in charge of procurement for the government of Guam? The government's chief procurement officer, Claudia Ikfaji, or the governor? Or her legal counsel, Hai Hyun? It was a night of contradictions at the Guam legislature. Senator Sabina Perez had called the oversight hearing to look into procurement during the pandemic. But minutes before the hearing, Governor Lulian Guerrero invoked her executive privilege. In a letter to Oversight Chair Perez, the governor wrote that she is saddened that her public comments and private explanations regarding the quarantine facilities have not been sufficient. She added that she was not sure about the purpose of the oversight hearing, adding the issues concerning quarantine facilities have been repeatedly addressed in multiple forums. Quote, I do not have any other information to provide. The governor's legal counsel, Sophia Diaz, and Hai Hyun did show up virtually but didn't answer a lot of questions. Hai instead read a portion of a written statement providing a chronology explaining the use of digital and what signatures. A public health director, according to the statement, Guam Homeland Security Advisor Tim Uggan dropped the ball, so the governor directed Hai to step in and handle the procurement. This despite the fact that that's the job of the chief procurement officer for the government, Claudia Ikfaji. And here's Claudia Ikfaji as she testified during that oversight hearing last night.
So in regards to the procurement of quarantine facilities, what was your involvement with that, and what was the earliest that you were involved in the procurement of those facilities? What was your involvement?
On May 9th is when we actually GSA received a requisition from Homeland Security to procure for quarantine or the QFAC facilities.
Okay, so the fact of the matter is that the quarantine facilities were used much earlier, before May 9th. To your recollection, who was doing the procurement prior to that?
I'm not aware, Madam Chairman. I had no involvement before May 9th.
So on May 9th was the first time you had any information regarding procurement of quarantine facilities. Did it raise any flags to you that, or first of all, were you aware that quarantine facilities were being procured prior to that date?
I kept hearing, about quarantine facilities being used again through the media and everything, and I received emails from Mr. Hai and Tony Babauta, the former chief of staff, regarding the I guess what transpired, or trying to explain that they need some assistance in reviewing documents. But then after meeting with Mr. Lester Carlson, he mentioned that there were payments made already. So I'm like, it's a done deal. I mean, there's nothing I can do.
Because you're the chief procurement officer, you oversee the procurement for the Office of Homeland Security and Office of Civil Defense and the Office of the Governor. Why were you not taking the lead in all of this?
I believe when an emergency is executed or an executive order is issued by the governor under the emergency procurement, as is customary, we actually work hand in hand with the Office of Homeland Security. And in this case, as mentioned in Chapter 10 of the health emergency, as we were reading the executive order, it did not delineate that the governor suspended either the 5 GCA, which is the procurement statute, or the 2 GAR, the regulations, the procurement rules and regulations. And Chapter 10 did specifically say that if she was going to again, bypass all those or execute her powers, that it will be stated through an executive order. So my understanding is that we were again communicating closely with the Homeland Security Office, since in any form of emergency, that we again work through the DLAN system, so that again we're always thinking of reimbursement. Okay, and we again, based on our experience, we're familiar with what kind of procedures FEMA is looking for in terms of making sure that we meet our local procurement statutes as it relates to the procurement process.
Isn't this a cause for concern or a flag? Does raise flags as chief procurement officer? And what steps are you going to do to find that information, or what is your role in getting that information?
Again, Madam Chair, again, for my understanding, or at least my understanding, is that again, they're already at the point of invoices. So I really don't want to get into any mess that I wasn't aware of. And of course, I did raise concerns with like Mr. Chuck Davis, in regards to communicating with Homeland and Office of Civil Defense like traditionally I do during an emergency. Communicating with Homeland and Office of Civil Defense like traditionally I do during an emergency.
Okay. During that oversight, Carlo Branch, the governor's chief policy advisor, he talked about the governor's Title X superpowers, which are backed up by the Organic Act and case law, and that it was the governor who was in charge of the procurement. Meanwhile, it was made clear the AG's office was representing the governor and wouldn't answer specific questions, for example, about the unsigned contracts or emergency purchase agreements. The AG's office said when the governor's office contacted them for guidance, that kicked in attorney-client privilege, so they wouldn't answer specific questions during that oversight. The AG's office also talked about how federal law trumps local law. DOA Director Edward Byrne confirmed he had made payments at the order of the governor, even despite no contracts being signed. He also admitted that payments were made even before Federal CARES Act funding was made available. As for Linda and Pinko DeNorsi, she acknowledged that according to the same Title X superpower law Adelup keeps referring to, that she actually, as public health authority, has superpowers too, and that includes procurement. But it's something she says she was not involved with for the pandemic and specifically the procurement of quarantine facilities. Meanwhile, according to responses to FOIA requests, more than $1.8 million has been spent, as far as we know, for quarantine hotels. Additionally, following all this controversy, new contracts or another round of emergency procurement for quarantine facilities went through the proper protocols and were signed off by Claudia Ekfaji. As she confirms, it took all but 7 days. Another oversight is expected to occur in the future. And speaking of contracts or agreements, apparently there is not one in place for the governor's Tier 2 clinics. These are FHP, SDA, and AMC. The governor, through an executive order, announced she had directed to help for these clinics to help with the pandemic. Neither of the clinics have been paid a penny.
Just to set the record straight, Chris, I pay as invoices come. I pay as bills come. And so for the hotels, we are starting to get invoices and bills, and I understand from DOA that they are paying those vendors. As far as the clinics, I have not really received any invoices from the clinics. I know that there is discussions with attorneys about the MOU and the memorandum of agreement, but to this date, I have not seen any invoices from the clinics.
Okay, so you're saying that if they give you the invoices, are you going to use your special powers to pay them right away, or?
I don't need to use special powers to pay them right away. I used my emergency service authority to purchase the services, but the payment as they come, the billing as they come in and the invoices as they come in is a responsibility of the Department of Administration, and that's part of doing business, and that's part of our operations, that's part of our obligations that we are continuously paying as we.
And let's head over now to the CNMI, where Tomas Manglotnya is standing by with the latest. Tomas.
Good morning, Chris. Here's the latest in the Northern Marianas. The first flight amid the pandemic to Rota and Tinian take off this morning from Star Marianas. KUAM spoke with the president of Star Marianas Air, Sean Christian, yesterday on updated protocol. Take a listen to that interview.
There's a lot of opportunities for miscommunication. There's certainly, we don't think anybody had any malicious intent.
As Star Marianas prepares to take off on Friday, it's clearing the air after the CNMI governor's office makes its own course correction on inter-island flight protocol. It was initially announced that travelers within the CNMI would need proof of a health evaluation to board. Star Marianas president Sean Christian says that isn't the case.
We are not requiring health certificates upon check-in. That is the policy moving forward. Not really too sure. There's, again, very dynamic times right now, a lot of changing policies and procedures.
Those changing policies responded to late last night by the CNMI COVID-19 Task Force in a statement writing that CHCC has seen and received numerous residents who specifically ask for a health clearance form instructed by Star Marianas Air in order to fly to Tinian or Rota from Saipan.
There was mention made that there would be some personnel located at the airport, conducting a screening on behalf of the CNMI. That's sort of beyond the scope of our operation. So I really can't speak on behalf of CHCC.
Christian reassures concerned inter-island travelers that pilots and staff running his fleet of 26 airplanes are prioritizing the safety and health of all passengers.
Our sanitization program, our request for face masks, we believe is a very good start. We think that passengers, first of all, we are not against anyone getting health screening or testing or anything else that they want to do to make sure that they're not putting others at risk, including our flight crew members.
Their flight schedule starting on May 22nd shows flights between Saipan and Rota operating every Tuesday and Friday. There are some daily flights between Tinian and Saipan. There are no flights between Rota and Guam. Tomas Manglotnya for KUAM News.
Breaking last night, the Commonwealth Healthcare Corporation announced one new case of COVID-19 on Saipan. The individual is a 27-year-old female, asymptomatic, and is a contact of prior cases. The CNMI government's press release says the case was identified through contact investigation and community testing. They add that cooperation of primary contacts who were interviewed led to the discovery of secondary contacts, which allowed for quick identification and isolation of the individual in coordination with the community-based testing initiative. There are now 22 confirmed cases in the CNMI, 7 are active, 13 recoveries, and 2 deaths. And in an effort to stop the spread of COVID-19 in the Northern Marianas, the Governor's COVID-19 Task Force reminds the general public that Maniagata Island and the Grotto remain closed until further notice in pursuant to Directive 14 of the Emergency Directive. All other public beaches and pathways are open for individual use of exercise wellness, including swimming and shoreline fishing. And here are the latest numbers from the Commonwealth Healthcare Corporation. We have now 22 confirmed cases, 421 people released from quarantine. The deaths remain at 2, and we have 13 recovered cases. And we do have updated numbers from the Community Testing Initiative for all of the Commonwealth. They've tested 3,764 people in Saipan now, and new numbers coming out of Rota and Tinian. Tinian has tested 137 people so far, and Rota has tested nearly 200 people. Brian, Chris, that's the latest here in the CNMI.
All right, thanks a lot, Tomas. In national news, as states start to reopen, a new study shows lives could have been saved if the government had been faster to order lockdowns. Skylar Henry reports.
The coronavirus pandemic has claimed more than 93,000 lives in the U.S. so far, but a study from Columbia University shows more than half, some 54,000 people, might have been saved if the government had imposed social distancing measures just 2 weeks earlier.
We have made incredible sacrifice. We can't let that have been made in vain and just drop our guard and go back to life as normal.
The CDC has issued guidelines on how states should reopen, but the guidance for churches has been shelved for now because the White House disagrees with the initial plans.
Why are there no guidelines for churches or things?
We are working on those. Those are actually in my inbox.
So there will be something?
Yes, they're expected to be.
President Trump is headed to Michigan this afternoon to tour a Ford factory that switched to making ventilators. Ford has asked the president to wear a mask during the tour. The president criticized Michigan's Democratic Secretary of State after she sent absentee ballot applications to voters there. He then threatened to withhold funding to the state because of voter fraud concerns.
Threatening to take money away from a state that is hurting as bad as we are right now is just scary, and I think something that is unacceptable.
Michigan says absentee ballots will allow people to vote while maintaining social distancing. Skylar Henry, CBS News, the White House. The White House.
In your Banking 671 report, the Bank of Guam announces the reopening of its Jigo branch beginning next Tuesday. Extended hours have also been announced and also begin next Tuesday. Guam branches, Hagåtña, Upper Tumon, Anderson, Mangilao, and Jigo branches, and Tumon drive-through, 9 a.m. to 3 p.m. Monday through Friday, closed on Saturdays, 7:38 a.m. to 8:30 a.m. Monday through Friday. The Hagåtña branch and drive-through Manumco hours, and again, they are closed on Saturday. And that is your Banking 671 report, brought to you by the Bank of Guam and Coast 360.
All right, thank you very much, Sabrina.
You're welcome.
I was just texting my buddy Linda Pinko Denorsi. We're getting Dr. Jana Manglotnya on. Of course, like you said, there were a lot of contradictions in that oversight hearing last night. And I think the person who was the most contradicted was the governor's legal counsel. If you followed the oversight, and if you didn't, I put it up on my Facebook. It's on the Guam Legislature's YouTube. Highly suggest, and I know a lot of you guys watched it last night because what else we got to do? Highly suggest you guys watch that. It was just really, again, we've seen so much during this COVID pandemic. Every day, I'm just amazed at what else they throw at us. And this was, I mean, just from the get-go, an hour before the hearing, the governor sends a letter down with the statement and saying that she's not gonna waive her executive privilege.
Yeah. And I don't even know if it was an hour or, because I know Senator Tello Taitigui, I'm not even sure if she got it or she got it a half an hour before, and it was clear that Senator Sabina Perez didn't even get it, and she's the oversight chair. So when she started the oversight hearing and she was beginning to ask Attorney Hin questions, she had no idea.
And I mean,
that this letter had been sent.
It's just ridiculous, really. I mean, attorney-client privilege, executive privilege, and I gotta say, Sabrina, that the Adelup, obviously, there's just no respect for the legislature at all. I mean, to go into this oversight hearing and tell senators that, yeah, I'm not going to answer anything, I'm just going to read this statement. And anytime you ask me something, I'm just going to say that I can't answer something. And the tone, you know, we had Senator Teresa Lahi on the show this week, and she was talking about the attitude that they get. And it was on full display. The pettiness coming from mostly the Adelup side. And then the Attorney General was represented by Attorney Jessica Toft, who I just thought was that, I mean, a smart-ass tone, I shall not answer that. I mean, why are we having a hearing if you guys can't answer anything?
Attorney-client privilege.
I mean, aren't we the clients, though? That's the way I thought about it. I thought we're the clients because we're the people of Guam.
Yeah, I was like, who is she representing? Who does the AG's office represent?
Apparently, they represent.
I thought they were looking out for us.
The governor. They get the legal opinions that support the governor. They, use attorney-client privilege to protect the governor. And, I thought Senator Teresa Lahi brought up a good point. I mean, there were many great points brought up during this hearing. But as she had said, that the Attorney General's real job is to vet these agreements to find out if they're legal, not to hide behind attorney-client privilege. I mean, clearly, Bree, it's pretty simple to me. Either things hold up to public scrutiny or they don't. And it's clear that this whole process is not holding up to public scrutiny, so much so that they can't even answer questions about it without incriminating themselves. And that's really what...
And who knew there was a new way to procure through emergency purchases or emergency... I don't even know. I don't even think Sabina knew.
I mean, if you watch that hearing, and if the Attorney General watched that hearing, I think it's very clear that there needs to be some kind of action.
And why didn't he show up?
I don't know. I mean, any question that you guys might have had about the Attorney General's ability to remain impartial, and I think that's been a huge question since he took office. I think the answer is clear. No, he cannot. There's no way. After last night, after watching them go to bat and defend and block and not answer questions to sitting senators who we elected. We gave the senators the power to look into things like this for us.
And this was the statement, right, on May 14th, when we asked the AG's office about why he didn't sign off on any of these contracts or agreements or whatever we're calling it this
dead
time.
Trees.
Right. And so this was a statement. Guam law affords the government extraordinary authority when responding to a public health emergency, and our office has been actively assisting our client agencies in responding to this unprecedented COVID-19 pandemic. But we all recognize that extraordinary does not mean limitless. Our office will continue to review government contracts and the procurement process for compliance with the law, including the documents posted on the governor's website, but we are unable to comment on the legality of the documents or the process until we have enough time to adequately review them. So they're going to review
How can they review it, though? Because they're conflicted.
Exactly.
They're totally conflicted, and that's the point Senator Theresa Lai brought up. She had used the instance of the illegal raises and said, hey, the AG's office gave advice. Later on, when all hell broke loose, they had to hire a special independent investigator prosecutor to look at it. And so clearly, if the Attorney General's office is saying that they can't tell us anything because it's attorney-client privilege, how are they going to look into this independently? They can't. They can't. It's simple. They can't. I mean, I'm even questioning the public auditor's ability to remain impartial. I mean, Governor Eddy called up and a lot of people got butthurt, but I got to agree with him. There are major questions about the Attorney General's ability to hold the executive branch accountable. And I think that the public auditor is being lumped into that, because I'm the inaction, the silence, it's deafening. So anyway, going back to, because we're going to bring on Sean Gumatato here, Linda and Pinko DeNorsi, and I think, again, when you watch this hearing, it's very clear that good people refused to do questionable things. They refused. Claudia Agfaji said, oh, it's a done deal. I'm not signing nothing. And you can see the paper trail, the stories that Sabrina has done on this procurement. It's clear that they tried to ram it through the FEMA reimbursement process, but Charles Esteves said, I'm not signing that. Claudia Agfaji said, I'm not signing that. The certifying officer said, I'm not signing that. Even in some cases, the governor didn't sign it.
And the Attorney General. Didn't sign it.
So, again, I got to go back to, we elect these senators to have the authority to go in and conduct these oversight hearings. And if you read, I know you read a little bit about the governor's letter that she sent down to the legislature an hour before the hearing started. And the tone of that letter was like, why do I got to tell you guys anything? I mean, we already talked about this in the media so many times. I don't have anything else to say. I don't think that they get to say that. I don't think that they get to say, we don't, we're good. We're good. Yeah. KUAM's asking about that every day. So now go watch KUAM. That's what they're kind of saying. Oh, it's been in the media.
Where is that letter?
Yeah, so we'll get that letter. But we wanted to bring Sean Gumatato on, and I don't know what hat he's wearing this morning. Sean, good morning.
Hey, good morning, Chris and Bree.
Hey. So, did you watch the oversight hearing?
I did. I always watch. Was watching with particular interest, considering as they're talking about midway through, talking about reviews of purchase orders and the like. And I guess, and I'll just talk about it just now. Is there was a story in the PDN last week about even our purchase order with the government of Guam, and I will tell you. You mentioned it just a couple minutes ago about process and about being proper. Well, at least I can assure at least the one I'm working with now or working to get back onto was done properly. So I can't speak for the other ones. But I think it was just this, as these things started to unravel, and I would say probably assuming after Tony Babalta's resignation, a lot of this just started to come to pass. So and it's part of a process that I think it's important for everyone to know. And I think yesterday when you had Attorney Brown on, he was really pointed about this process, and I think sometimes we just kind of forget. But I will tell you, it was a very long 4 hours last night. That's for darn sure.
Mm-hmm. Excruciatingly long.
Yeah, I was watching, and it's even crazy if you look on the YouTube. YouTube has a limit, right? It goes, okay, we'll have two parts of this. I mean, even that's how long it is, even for most people who would be a casual observer. But it was in parts of it, it was hard to follow because it was, you have to wonder about if we were understanding the questions being asked. And you guys brought up some really great points this morning, and I mean, I think I share much of your sentiment too.
Mm-hmm. So you've worked at the governor's office. You're the former communications director for former Governor Felix Camacho, and you also were in charge of the Joint Information Center during your time with the former governor. based on what you watched last night, what you heard last night, is this how procurement is handled? And is there such thing as what did High say? Emergency purchases, or it wasn't procurement, it was emergency purchases. I think that's what he said.
Yeah, as I listened to that, I had to just go back to my experience, and I would tell you when I was listening to Claudia,
yeah,
and to Chuck Esteves, that is the process that I think not only most of GovGuam, but most of those who support GovGuam are familiar with, and it continues to work to this moment. Now, the other process, which was this the quarantine facilities, there's always going to be that opinion that what they were doing was the right thing. As they felt that something wasn't happening quick enough, that they needed to do something, and so they did it. And now, as the whole community is watching what's happening now, all it's saying is, okay, for me, as a person who's done this before, it's likely that this is not going to get reimbursed by the feds. It's going to be a GovGuam bill that's going to be eaten and under the general fund, and we're just going to have to move forward. And I think that's something that I don't think was really...
Is it, though? Because we're using CARES funding?
Well, even if you're using CARES funding, remember, if you're going to follow a process, and if you don't follow it, why would the federal government want to reimburse something that wasn't done correctly?
Yeah, and I think that was kind of what they were floating out there, was like, yeah, all of this doesn't matter because we're going to use the CARES Act funding. Well, I know they're going to audit the CARES Act funding, and when they do, if you don't have a single piece of paper or unsigned contract, what do you think the federal government's going to say?
Well, and I just go back to our experience. There was a couple of bills that were not paid during the Gutierrez administration and during the Pang Songhua response. It had to go to Congress to get paid. There was a payment, I can't remember if it was some kind of waste removal, but it got a federal or a congressional appropriation. That was down the road years after the response had ended, because this company wasn't going to get paid, and they got obviously when you have if you live in a state and you have state representatives and state senators, it's a little bit different. In our case, there's a strong chance that because of this, and this is just my assumption, unless something happens today or the next couple days to change the course of this entire issue, it's likely it's something that the general fund's going to have to absorb.
Yeah, Sean, and I got to go back to what you said about the process that Claudia Faggi and Chuck Esteves had talked about as, you know, that's the way you do it, obviously.
Yes, exactly. And that hasn't, I don't think that's changed. It's not broken. I think people would agree that that process is still alive and well, and many of those corporations, including ours, who's done work with the government, has followed those rules, because obviously there's a lot of scrutiny. And who would want their business to be under the microscope during this most difficult time? And it wasn't like we didn't follow the process, and so it's very difficult for people to say that, or for all of us to watch, and if they followed it and see others didn't, then we're just like, hey, well, we're just going to keep moving forward,
right?
And that's all you can do.
Yeah. Let me ask you, Sean, as a former communications director at Adelup, executive privilege. My mind was blown when I read that executive privilege, and I just can't put together how Adelup can continue to say that, no, we're transparent, we hold people accountable. But lo and behold, when it comes time to answer questions, you're going to hide behind attorney-client privilege and executive privilege. How have you ever heard of an instance in the government of Guam where a governor claimed executive privilege?
Yeah, see, and this is where we have this whole idea of the separation of powers issue, and she can raise those, and obviously we, if you're another branch of government, you should respect some parts of that argument. But I will tell you, it goes back to what we spoke about maybe 21 plus days ago when I was on your show last or so. It was talking about this idea of being, the whole reality of the situation and the reassurance that needs to be given. If you heard that and you think about the response, that still comes into question: is the reality and reassurance here? I don't know if the executive privilege issue amounts so much in these. Remember, it's an oversight, and that's another thing. It's so
it's such an interesting thing to see, an oversight hearing in the middle of a response. We still got people, and remember, if you all woke up, remember 11 cases. We're still, we're still in an executive order that's closed. We still have all these things that are impacted, but we forget that. We're trying to get to the heart of issues that can be corrected after. We're trying to correct matters in the middle of a response, and that's the only thing. And I'm with you guys when you guys are being very very critical of the response, and it makes some sense. But when we think about legislative or policy, that's really going to take a little bit more time after this, especially when all of the missing parts and the screws that were not on these plates of policy are not, are unloosened and tightened again. We won't see this until after. Because I think you mentioned just a couple minutes ago about the OPA and the Attorney General, specifically the OPA, and they're going to be there at the end to kind of say, hey, was this done correctly? I think we'll find out soon enough.
Yeah, and I think also, who would think that in the middle of an active response, you would see like the chief of staff resigning. You would be hearing about situations where you have the cabinet officials working at quarantine facilities. So I think, and you have the lieutenant governor saying, oh, red flags are being, So when you hear that, you see that, I'm sure the legislature was concerned. We were concerned. The people of Guam were concerned. And I think that's why we're seeing, and that's where we are at today.
Yeah.
And why we are at here.
The process, in some ways, Sean, it's already been corrected, right? So I asked the governor yesterday in the press conference, hey, if you stand by your superpowers and you did this way and you continuously say that it was legal, it was above board, it was, within your powers, then why'd you change? Why didn't you just keep doing it that way if it was totally fine?
Right. I think we heard her response, and again, we all can't be in that. We're not in that seat. And I think when she's saying she did that, and obviously there's a lot of opinion about that whole thing, and everyone will vary. I think just depends on, one, if it's a leadership style, it goes down to how they read the law, what they're trying to accomplish. But I'm of the opinion that the process was it's a very we're one of the few American communities that has a process that is pretty straightforward. It's been praised by FEMA and the federal government on many occasions. Why we would change our horses in midstream is something that I'm still trying to get my head wrapped around today.
Yeah, Claudia clearly stated that it took them all of 7 days to do this emergency procurement the proper way, the correct way, the traditional way.
And I will stake her 2 decades plus experience, maybe almost close to 3, in what she's doing, and I think we, as our small community, can be well assured that she is doing her darndest, and someone with her vast knowledge, with some people behind her. Let's don't forget her staff are some of the most experienced at doing this, especially in emergency.
Right.
Those guys didn't start yesterday. They've been there a long time.
Right. And Claudia was there when you were over at Adeloop, when you were in charge of
She was there for 8 years. She was there, and before that, I think she came from GPA. She was at GPA during the Gutierrez administration. Do you think she did not work on disaster claims? She had done that. She had done this work, and her staff around her. And I know many of them personally. There's some great people there that understand the process, and I think that's, calling them in and asking. It's not hard, but I think sometimes in an emergency, especially these uncertain times, it's very difficult for us to get our head wrapped around. Sometimes they just are going to do things that just might be a little bit different, and it wouldn't be the same as what happened, say, a couple responses ago.
Right. Sean, I want to ask you, because there was a point in the hearing where the Adeloop policy director, Carlo Branch, came in to bail out the legal counsel. And when Claudia had said, it took us a week, they had chimed in, we didn't have a week. But then Mary Rhodes had said that they had been looking at facilities since January. Yeah. And, I want to go back to the criticism that was being said when the rest of the world was dealing with COVID-19, and people were like, why aren't we doing anything about COVID-19? It got like a sentence in the State of the Island address. And so this argument that, we had to act so quickly, I just don't, it doesn't hold water with me because we knew COVID-19, and had you acted sooner, you would have been able to do it the right way.
But it also, Chris, sounds like they had been working on it since, well, I mean, Mary is one of the most credible voices in this COVID-19 pandemic response. I take her word at it. She worked, I don't know how she pulled off the Theodore Roosevelt issue, but it goes back to, again, these are the credibility of a lot of professionals who are bringing to bear their knowledge and experience upon a particular response.
Yeah, and I thought that was a pretty. It was almost like a movie when you had the governor's legal counsel saying, "Oh no, we did this with GHRA. They were totally on board for all of it."
PacStar, all of it.
Mary Rhodes, yep. And I felt like they were trying to piggyback on Mary Rhodes' credibility. It was clear.
But Mary Rhodes made it clear she was not involved with PacStar.
I mean, that was crazy. When she entered that Zoom hearing, I was like, oh my God.
I know.
Yeah, right. I mean,
I was like, well, you just got caught in a lie.
It did change the complexion of that hearing pretty quick, didn't it?
Yeah, and then I
she
think
called out Carlo.
Yeah,
I
that was
like,
so,
oh my goodness.
You know, and I just, man, Adelup, you only got Carlo Branch. He's your go-to guy. I mean, they weren't even really listening to him, and I think it's because the points he's bringing up have already been dealt with and put away. You know.
Right.
And Mary Rhodes had, I just don't know how many times the Adelup legal team was contradicted last night, and I don't know what to call it. I mean, they keep trying to, I feel like they're almost trying to back Linda and Pinko Donorsi into a corner, and you had Linda herself say in a hearing with the senators that she didn't recall the call. Mm-hmm. And then when they were talking about that yesterday, Carlo Branch tried to interrupt and give his version of events. It's like, what do you got to do with anything?
Mm-hmm. Right. And
we already heard it straight from Linda, who, again, was messaging this. I said, hey, good job at the hearing. She says, I just tell the truth.
Right. And that is something that, in my working with her, she is, again, she's one of the best in the business. And, you know, we talk about how we tell our employees, hey, what can you do if you keep at your job? Well, one day you can be the head of the director of the agency. And she shows her support and her knowledge of her agency, and also how much she backs the people that are doing this response. Those guys are out there right now at the airport picking people up. Mm-hmm. You know, her public health people are making calls to those that are positive. She has to have this. She has this all in front of her, and she's still having to answer those questions. I mean, she is the agency's director, and she's doing her darndest. And I think this morning, as we're all pondering what happened last night, I hope no one's forgetting that she did. That's her job, and she's doing her best. And I think that we're just forgetting that.
Sean.
And she's the public health authority.
Right,
That's what I got. Like, she is in charge.
She's the one that should be running it, not.
Right. No, I mean, again, but it goes back to process and how this is. I mean, last night they were saying, oh, it's broken. I'm like, well, that's debatable. But that's their prerogative. From a policy point of view, if the legislative branch believes there's something broken there, well, that is their role under the Organic Act to help fix. And hopefully they can get more details and help. They can, see what they can do to assist in this very difficult time and uncertain time.
I think in reading all the emails, because we have all the emails, I don't think anything was broken. I just think they didn't know how to do it. I mean, it was clear. If you read the emails, the governor's legal counsel went out and did all this stuff, and then he went back and tried to get Claudia Kfaji. There was an email I read that he sent to Claudia. It was like, hey, I need help with this, and to compile a procurement record according to the AG's office.
Sure.
So there's a lot of stuff that they didn't talk about, and they cited attorney-client privilege. But if you go into the emails, it's all there. I mean, yeah, they basically ran cover.
Right, and remember, the one of the key parts of the in the phrase executive branch is execute. I mean, that is their role is to execute the laws of Guam. So they're trying to do their best with what they have to execute. And during this difficult time, sometimes it's kind of like they call it like the fog of war, for lack of a better word, this morning. But when you think about it, we have to rely on the professionals who've done this, and I think that might have been overlooked, in the last couple of weeks or so. And I'm hoping that they're not. I think moving forward that they can change that direction and help support them in a better way.
Right. Hey, what are you are you familiar with the Title 10 Special Powers Law that Carlo Branch has been constantly referring to, the Adelup keeps referring to.
Yeah, I mean, from my whole experience, yes, and there was a lot of stuff. There's a lot of things in that title and in that particular statute that gives the governor, a really wide range of. We use the word power, but it's the authority to do certain things, and I think, but it also they can't use it without the support of people like a Linda DeNorsi,
A public
the
health
director.
authority.
Right, because she even has even greater authority. She's one of few directors in the government today who have maybe more authority than the governor of Guam. I can think of a couple of different ones: the state historic preservation officer, the public health director, the tax commissioner. Those particular jobs they have way bigger authority than the governor, but they work in tandem to again go back to execute the laws of Guam, and that's what I think we're missing is that's what their role is in support of in this case the support of the response.
Mm-hmm. But it seemed like she really didn't have much of a say, or practically no say.
Right. I mean, and I think there's and that can be debatable, and I think many of us would maybe agree or disagree. But the whole notion of the authority is there. It's in statute. Again, if policymakers want to make the change, then they have that prerogative to do so. But in the heart of a response, it's we're dealing with what we have. It goes back to the pandemic plan itself.
Mm-hmm.
We had these conversations before as well. The plan's old and it needs to be updated, and it had been. But we're working through it, and I think that's all we can do.
Right. Is it typical that the Homeland Security Advisor would be on take leave in the middle of a response?
I'm not really sure about that, Bree. I'm not sure. Hopefully his health is good.
No, I mean, is that
Wait, did I miss something?
I mean, is that something that would typically happen? I mean, yeah.
No, not
in the middle of a response.
Yeah, not typically. But remember, you have guys like Chuck Esteves who's there to support. So, I'm not sure why. That's a great question. I'm not really sure.
Wait, did I miss
wait, did you
something?
hear that?
Yeah, can you fill me in?
Because you said that he hasn't been involved. So why is he not there?
No, I'm just wondering. Is that typical that Homeland Security Advisor?
It is not typical.
No, okay, yeah. Because
Why?
I'm hearing he's on leave.
Oh, okay. So we're talking about, and that was somebody who was definitely missing was the Homeland Security Advisor, Tim Uggan.
Yeah,
they were throwing his name around, or the position.
That was.
And why wasn't he there?
Yeah, that's a great question. I have no idea. I was wondering why he wasn't there, sitting with Chuck.
Well, I think that Senator Sabina had said that did they not invite him, or maybe it was an oversight on the oversight? I don't know.
Oversight of the oversight. Okay, there's.
Mm-hmm.
I don't know. That's a great question. I think you might want to ask.
Yeah, we'll try and reach out.
Are you asking me if I want to ask them about that, Sean?
Oh, sure, man. Chris, you do a great job, man. I mean, heck. But we can have Adriana ask.
Are you asking us to have Adriana ask?
Hey, man, I've been listening to the press conferences too, man. You guys are doing a good job, and it's like I said to people before. If you're not listening to this show during the day, you kind of missed a lot. Let's be honest, especially with this response. And you guys KOM's doing a great job. And if I can say it publicly on behalf of everyone that's listening, you guys just keep up the good work, and you guys continue to ask those questions because they're very timely and they're very.
So are you asking us to continue asking questions?
Sure, if you're able to ask more than two.
Okay.
All right,
Thanks, Sean.
Have a good 3-day weekend.
I sure will. Hey, you guys have a great holiday weekend and be safe out there. And again, hopefully everyone will heed and keep their social distancing and and then have a good weekend and be safe.
Okay. Thank you, buddy.
I'm washing my hands, Chris.
Okay, thank you. I was going to say.
Thanks,
right on.
Chris.
Yeah, is that a lawyer thing, Sabrina?
What?
When somebody asks you a question and then you ask them if they just asked you the question they just asked you? Because that happened a lot at the hearing. They asked the governor's legal counsel something and he would be like, "Are you asking me what you just asked me?" Because
Can
if you
cite
are
that law?
Yeah.
What law? That law? Which law? The federal law. Which federal law are you referring to? The one that's applicable in this situation.
Clearly combative. Clearly hiding things that they don't want the people. And I'm going to go back and I'm going to keep saying it. Either it holds up to public scrutiny or it doesn't. And this clearly doesn't. If they need to cite all kinds of verbal legalese, jiu-jitsu style, just to... And we're kind of just getting started because, as you know, we've also been trying to follow this issue of the tier 2 clinics. And you have a tale of two emergency, I don't know, what are we calling it? Purchases or whatever.
Well, I don't know. I honestly don't, because, you had the executive order. Well, first you had the governor when she appeared before the Guam Medical Association. I think that was on March 5th.
Right.
And there was a question by Dr. Jolene Uggan and I think we actually have that. Let's play that. This again is what happened at the Guam Medical Association. Some of the doctors that we've had on the show have talked about this, and this is when Dr. Jolene Uggan asked about her public health authority.
Right,
and powers.
so this is going to come out as an audio clip on our Facebook Live feed because we didn't get to load the video. But again, like Bree said, this is the governor addressing the Guam Medical Association.
March 5th.
In the event we declare the island as a pandemic emergency, would satellite clinics such as American Medical Center, FHP, or SDA, will the government provide us with extra supplies such as
Dr. Shea's clinic.
Okay, Dr. Shea's clinic and all other clinics there are, right? Would the government be able to provide supplies such as gowns, masks, and gloves, or even extra personnel to assist?
So if we declare a public health emergency, the governor has authority for everything. And so I can say to AMC, you are now under government authority, and this is what I want you to do, and this is how we're going to do it. I don't expect to be at that level of a public health emergency, but if we do declare a public health emergency, there is local legislation that allows me, I have authority. I have authority to take money, I have authority to take property, I have authority to move personnel wherever I feel they are needed to be. So yes, we would have to, basically you have no say. No, you will provide the government, and we will work together, because I'm going to use your facility maybe for triaging or maybe for isolation, depending on what the case may be. That's the authority if we declare it a public health emergency.
You know what I was thinking about yesterday?
Wait, again, that was on March 5th when she spoke before the GMA. And we do have a public health. She did declare a public health emergency.
Yeah, and I remember when this happened, doctors were kind of freaking out about it.
Mm-hmm.
Right? They're like, "What? You can go in and take over our clinics? You can take it?" I was thinking yesterday. So much of the conversation during the COVID coming out of Adelup has been about the governor's authority, has been about the governor's powers, has been about the governor's superpowers. I mean, that's really all they talk about. Special powers. That's all we hear about is the authority. And let's go to Dr. Hoa Wen, who, is a member of the Governor's Physicians Advisory Group. He's been also, I would say a vocal critic of some of the things coming out of the administration. So, Doc, can you take us back to that clip that we just played? What was the sentiment with the doctors when the governor had said that? Were you there at that forum, and what was the reaction?
Yeah, good morning, guys. That's, we really, I know the governor say that we really just not think much about it, because like I say, at that time, really, we don't expect it to be a pandemic emergency. So we just go back and prepare at the clinic in case it gets worse. But we were concerned about what is our right as a clinic, as a private clinic, during this comment. But like I say, it's we didn't expect it to happen, and expecting to get worse for a short time there. So, it's for the governor. I mean, we have a discussion. We talk about it, and the Tier 2 and the CARE Act come up. We kind of say, well, we were willing to help to be the Tier 2s, and we have a lot of capacity to absorb patients. More than the single clinic. So I think that's why SDA and FHP and AMC kind of stand up in the CARE 2.
Did you guys volunteer to be Tier 2 clinics, or were you directed as per the executive order?
No, it kind of not volunteer nor direct. I mean, at a certain time, she asked us to see were we willing to help out, and at the same time, we are willing to help out. So it's kind of an effort between the two, the governor and the Tier 2 clinic to kind of come together as one and serve as a Tier 2. So she's not really, at the time people say take over, it's not really take over. It's the work is a combination of the two.
Mm-hmm. But part of that executive order, it made mention of a memorandum of agreement for reimbursements and things like that. Where is this memorandum, or MOU, or MOA, or emergency purchase agreements, or unsigned contract? Where are these documents?
On the CARE Act, it does mention that the Tier 2 will get reimbursed.
No. The Federal CARES Act doesn't say that. You're talking about the breakdown that BBMR provided, right?
Oh, no. We don't have any contract, not at this point. No MOU to get reimbursed. I think that the admit side of the House and the 3 clinic are working with the AG office. I know it's we go through the kind of proper channel. It's got to be blessed by the AG office in order for us to move forward. So I think right now it's at the AG office. So, we really can't turn in or expect any reimbursement at all until it's been go over to proper channel with the AG.
Right. So, Doc, I want to ask you. I mean, the subject of the government paying for services with no paperwork. I mean, that's the conversation right now. So, how are you clinics feeling about your chances of getting paid? And and then also I want to ask you to respond. Yesterday in the press conference, I asked the governor why you guys haven't been paid, why they use the superpowers to rush through payments for some things and not others. So how would you respond to the governor saying, hey, I can't pay these guys, we don't have an invoice?
Yeah, I think that anything else in order for us right now, the number one thing is, guys, we're going to take care of patients. Like I say, it doesn't matter if we get paid at this time or pay later. We will continue to take care of patients. That's number one thing. You can't delay that one. And the rest of them, we just have to go through the proper channel. We cannot, give any invoice to get paid without knowing that what we give is legitimate or not. The AG have to say what we can give and what we cannot give. And that's to be fair for everybody, because this is not the time for anyone to kind of make profit of this thing. This is where we step up and make sure that our cost is covered. So we cannot just turn in any invoice because, we need to get a guidance of what the AG really wants. Mm-hmm. So we know what we need.
Right. I've seen a couple of some of the emails, the back and forth between the governor's legal team and some of the clinics. And it's clear that these Tier 2 clinics have been financially impacted. You're providing government services because, COVID hospital, GMH, because it is designated as a COVID hospital. You guys are handling the, what do you call it, the overflow?
Right.
And so you guys are doing that. And then on top of that, you're handling your own patients. And so you guys, it sounds like you guys are struggling.
Well, and also, Dr. Hoa, we
without compensation from the government.
Right, and we've also heard that a couple of clinics have had to cut back on staff, that one clinic has had to let go of doctors. So you're right, it is having an impact.
Yeah, it's in order to have COVID and see PUI or people that are sick in the clinic, you have to curtail quite a bit of your regular service. Just as a well child visit, we completed cut out well child visit for about a month. And even at this point, we only do half capacity because we just do in the morning for well child, in the afternoon we can see the sick visit to come in. You can curtail your infusion service. Just those things, because you don't want to expose those risky patient to any type of illness. We move our Medicare population to a totally different clinic in order to isolate them and non-COVID, make sure they don't get exposed to sick visits. So there's a lot of things that the big clinic, the tier 2, curtail the service in order to continue to do this. We were thinking of step down a little bit on our triage until yesterday when the 11th case come up. So we have to go back and make sure we brief our staff again to be very cautious again because it's still out there. So we do have to do that. But like I say, it's not a room that you can say I pay for one room and you're done. It affects a lot of the service within the big clinic in order to provide the care. Again, we'll continue to do what we do. We don't turn anyone away, or when we see a patient that's sick, none of the tier 2 clinic collect anything. It's a free service at this point, and we continue to do that until things go away and let the admin side of the house take care of it. Right. I know in the end we get paid something, but at this point that's not a priority to stop our service to people.
Right. Yeah. Doc, I wanted to read because I just got a FOIA last night about, and I asked for any and all communications between the Governor's Legal Counsel, the former Chief of Staff Tony Babauta, just a whole bunch of people, and the Tier 2 clinics. And I wanted to just read a little piece of an email from the Governor's Legal Counsel, which after watching the hearing last night and then reading this, so ironic, because they spent the whole hearing talking about how what they did, what little they did say about what they did because they hid behind attorney-client privilege, but they said that it was all legal, it was all well and fine. But in one of the emails to the Tier 2 clinics here, the Governor's Legal Counsel writes, "We have not received any indication that any medical facilities, supplies, or providers have been formally directed to act as government entities. This would have been in the form of a contract for procurement purposes. And as you know, procurement law does not allow for payment of services prior to the execution of an agreement." I just thought that was so ironic because that's exactly what we did for the hotels when the Governor's Legal Counsel was leading the effort. And that's why I asked that question, why was it okay then, but not now?
Yeah, I'm not a lawyer, I can't say that. I know that the CARE Act basically spell out that you to form like the hospital, the Commission Hospital, GMH, GRMC, the Tier 2 clinic, and Tier 1 clinic. So it's pretty well defined what your responsibility is to deal with this pandemic emergency. So you are under the umbrella of Gulf Forum on this CARE Act declaration that the Gulf Forum put out. So yeah, at this point, again, it's hard for us to do anything without a formal contract. Mm-hmm. And so far, like I say, I understand that from our counseling that the process to go through the procurement or whatever they call it takes a long time. So we just sit back and just wait. 7 days. That's the part where they either fast track you through the Procurement Act, or we're just going to go through the normal channel. And I think eventually, at the end, you will get reimbursed something if we do. Something. But again, it's something but at this point, it's not going to be the stop thing that we're going to change our practice. No, everyone walking the front door will be seen. And there's no appointment for anyone that gets sick, because our main goal here is just like the 11 case that public health did this very good job is identify, contain them. And that's just our job, is make sure that when people walk in the front door, they get sick. If we identify they have COVID, we contact, isolate them to make sure that Guam is safe. We continue to do
but
that.
I don't think you guys have a choice to back away from being a Tier 2 clinic. I think that was kind of solidified in this executive order that you guys are directed to be Tier 2 clinics.
Exactly. In order for us to get out of this thing, they have to lift the pandemic emergency.
Right, and that is tentatively June 5th? Right, 30 days from...
Yes, Yes.
Yeah, June 5th.
Yeah, if it's lifted, then the CARE Act will be dropped. But at this point, legally, it's very hard to us to back out of this thing.
Right. Doc, so have you guys gotten paid anything?
We got paid zero.
And, you know, actually, this was a letter from Speaker Barnes on May 4th. It was actually to Dr. Mike Cruz with the Governor's Physicians Advisory Group. You're on the Physicians Advisory Group.
Well, yeah, I'm
right?
the chair, yes.
You're the chair?
Yes.
Okay, and as the chair, I mean, has this even been discussed in any of your meetings?
Well, you know, I purposely never discuss in the meeting because I think it's a conflict of interest for me as one of the partners in the Tier 2 to discuss this. So I don't think it's right for me to discuss it. So we basically doing the advisory group mainly to talk about what's best to approach this pandemic and how to advise the governor in going forward in taking care of this. But we never discuss about any type of payment.
Yeah.
You know, to me, it's a conflict of interest.
Yeah. Good point, Doc. So when you talk about advising the governor with these 11 positives that we got, but we only had 0 last night because they're not going to test over there anymore because they're positives. I'm just kidding. So what's your advice going to be to the governor moving forward now that we have this cluster or spike, surge in cases?
You know, we know there's still case out there that we have not identified. No, this 11 case is a work of public health and the tracing team. And to us, as advisory board, it's very good that we feel confident that the tracking and the tracing team are doing their job. You know, so identify a source, they track it, they do all the history, and they come to the right place. And that's what gives us confidence to go from peak hole 1 to peak hole 2. As long as they have the ability to do that, the rest of the public should be very confident. I know that they communicate that with the mayor of Eagle and let them know what's going on. So it's very open to them, so that way the community up there can know and the mayor can do his job. You know, but this is where public health tracing on a positive case really work, and they did a wonderful job, and we as advisory board feel very confident in what they did at this point. So it's good that it's a cluster, it's a compound that they identify, so now that they can isolate this compound and people will not go out and spread it. Again, you know, the question is that a previous infection or is that an old infection that pick up this point? But they're going to go back and do a lot more history on these people and try to trace some more to see if they come in contact somewhere else. So it's a working process, but we know that it's working. So that's, again, you know, whatever they do is working at this point, and that's what keeps most of the days to 0. So we actually do very good in Guam.
Could you clarify something? I know that when we last talked, you had mentioned that the Physicians Advisory Group was going to put out the recommendation to the governor to allow for returning residents of Guam that have either came from the U.S. mainland or from the CNMI to be allowed to do home isolation or home quarantine. So they wouldn't have to do the 14-day quarantine at local hotels. I think that was 2 weeks ago. Where are we with that? Is this a clear response of no?
No. It's we wouldn't work with public health, and we come to very, very close to the home base on remodify the guideline and have a volunteer quarantine for our return resident coming back to Guam.
Yes.
So it's supposed to be volunteer. The patient or the passenger can have a choice if they have a family that they feel uncomfortable going home because they're so packed in the household goods. They have a choice of stay in the government quarantine facility if they choose, but they also have a choice to go home. So it's a volunteer quarantine at home, not in a hotel, and we come very close to it. I mean, give another week or so, it should be finalized and do this thing. And the governor is very specific; she wanted it done like ASAP. So public health along with the advisory board work together and try to finalize this thing as soon as possible. And to clarify who's paying for it, it's like if you are not from Guam, yes, you will be responsible for the hotel, and Guam not paying for it. So it's only for our residents that the government should pay for it. But again, it's a volunteer 14 days quarantine. So people want to get back from our island have to stay at home. And you can go shopping, you can go do stuff because you still quarantine at home, just like in a hotel. But it's a much more friendly environment for the people to come back, especially the college kids.
Okay, so you presented that, the Physicians Advisory Group presented that to the Governor and Public Health over a week ago?
Yeah, it's take time to kind of...
Because I want to say you said we got to stop wasting money here.
Yeah, I mean, it saves us money a whole lot. Right now, it's a lot of people in a hotel, which is, it costs a lot. But if you can quarantine at home and have a monitoring system to track them, it saves everyone. And psychologically, too, it's good for the kids to come home and our family to come home without having to worry about staying in a hotel. So it's a plus for everyone. At first, she had to do that. We don't have the power to shut down the airport and say no flights from the PI, from the Philippines, which is the main source of coming in. So we don't have the power to do that. So the only way you can do that is mandatory quarantine them in a hotel for 14 days. You do that, nobody come back, because they're afraid to be in a hotel.
Right.
So she had to exercise that right in order to shut down the flight. Because only the federal can prevent the flight from coming in.
Yeah, I think we've been through that.
Yeah, so now that we passed that stage, we have to come back in and we look and say, hey, what we did in the first few weeks, now we got to change it. So we have to change it. Again, we passed multiple bases already, so we are moving forward quite well. So soon, guys, we will be able to let our people come home and quarantine at home.
All right, Doc. Hey, I just want to let you know we got a comment here from BT Wen on our Facebook. It says, Dr. Hoa is my daddy. I'm so proud of him.
Yeah, that's my girl.
Well, she's
Daddy's
proud of you,
girl.
Doc. Okay.
Thank you, guys.
All right.
Thank you for everyone to put out the news there. But again, please, on the public, we still need to be very cautious. And again, I want to mention masks, social distancing at 6 feet, and hand washing. Really, guys, we need to continue to put that 0 on the book there, so that way we can open our economy and everything, be back to some new normalcy. Okay.
Thank you, Doc.
Thank you, guys.
Thank
Have
you.
a good morning.
Wash your hands.
Okay.
Okay, bye.
Bye-bye.
Okay, Dr. Hoa Wen of the Governor's Physicians Advisory Group. So we had some comments here. Someone said, stop working until you get paid. I think Dr. Hoa was very clear that they're going to continue to do what they're doing. And,
And it is what it is.
It is what it is. You have some businesses through the use of the governor's superpowers getting paid. But you know what? It kind of seems like she's talking a lot about the superpowers that she has, but they're not really trying to use them anymore. Because now they're using the traditional by the procurement book method. 7:35. Let's go to the phones here. I know someone who was scratching her head as part of that oversight hearing last night. Minority Leader Senator Tello Taitigui. Good morning, Senator. Thank you for taking our call.
Hi, good morning, Chris, and good morning, Sabrina.
Good morning.
I guess just we've got some questions, obviously, but we'll just give you the floor real quick. What was your takeaway from that oversight hearing last night?
Well, it was very long, but it was well worth it. I think there needs to definitely be a second hearing, a continuation. I was just very, very disappointed on the onset when they decided to send us over a statement that they were going to hide behind throughout the whole meeting. Look at our statement that we provided you. Provided us within less than an hour before we went on the air. Didn't even give us a chance to review it. And of course, that was their intent. I think that truly was their intent. And I called out high about it. I said, you know, it was very disingenuous what you did. Oh, we were not being disingenuous. I'm like, how are we going to be able to see what you wrote and being able to, dissect this and ask questions on something that we don't even have a time to research. But one of the things I figured they were going to use was the Organic Act of Guam. It's when all else fails and people are starting to dig in, or if there's a mistake that was made, use the Organic Act of Guam. The governor has the ultimate power, you know, and that's exactly what they did, you know, for him to say we're citing the Organic Act of Guam in her power. But hey, you guys, your favorite commentator was on, and you know, I made a statement earlier about Mary Rhodes and her comments. It was contradictory to what Hai was saying, that Mary Rhodes was the one that negotiated all these hotels, and that was absolutely not true. So, lie number one. And thank goodness Mary came on. I mean, Mary just really schooled them and just, you know, slapped Carlo Branch a new one. You know, it was priceless. But the best part of it was she had a chance to speak her mind. The one person I was disappointed not being there was Homeland Security, Tim Uggan. You know, his name was brought out a couple times during some kind of negotiations with I don't know who. Maybe
it made it sound like Tim Uggan was the one who just screwed the pooch on the whole thing. It started with him. He didn't do what he was supposed to do. So the governor said, "Hi, get in here, take over." That's what it seemed like.
I mean, but that's what they said, and we saw that they said a lot of things last night that were contradicted by the people that they said those things about.
Right.
Absolutely, Mr. Byrne. Oh, that was priceless too. Your girl did another one that it irritated Director Byrne so much that I'm not here to answer your question, Mary.
Right, yeah.
You know, so
I mean, I thought we were being transparent. That's what I don't understand.
What did she say? Oh, I thought it was people's money or
yeah,
something
she was like,
that.
I'm just a taxpayer. That's all.
I'm just a taxpayer.
Yeah.
That was priceless again.
And man, let me just tell you my Ed Byrne story. I'm just very disappointed because he's always been so forthright and so accessible, but what I'm seeing is you got people like Ed Byrne, like, you know, Linda DeNorsi, like Claudia Agfaji. These people, they kind of had, or at least I thought, most of them had a good reputation. And so we had Ed Byrne on here about these electronic fund transfer payments that were made, and he had committed to giving us information about other payments that were A, going to be made, and B, the amounts, and then whether or not they were made. So he said right here on the radio that, yeah, no problem, I'll get you guys that information. So after the show, I sent him a follow-up email. A whole week went by, no response. So I had to FOIA the information. And then he extended the FOIA, so that means we got to wait until May 30th.
To get it for you. Right.
I mean, and it's not like he doesn't have the information. It's electronic fund transfer. It's right up there in the computer. You just put a boom. Or actually, you know, in his case, you just bada boom, bada bing.
Yeah, and bada boom, bada bing. A pound, a dollar short, a pound.
Penny.
No, but you know, I was very disappointed in Byrne. You know, he's really a good guy to be able to answer the question. He might be very cautious and divulge only, you know, small parts of information so that he doesn't get in trouble. But we know that he's been, you know, he's following the directions of AdLoop.
And is that even, I mean, when the governor's legal counsel came on and they, Senator Sabina, the oversight, asked him, what's your job? What was his response? His response was, my job is to follow the governor's orders.
And I've been given a gag order to make sure I don't say anything else because the governor gagged me.
You know, I thought was interesting was the Attorney General, Assistant Attorney General Jessica Toft, and then I think it was Stephanie Manjola, the two that appeared on behalf of the AG's office, and the fact that Levin Camacho didn't even show up, and how they were saying that, well, we have attorney-client privilege, so we can't necessarily answer specific questions. And like Chris and I have said, we thought that the Attorney General was representing the people of Guam. I mean, why would he be representing, or the office be representing the governor?
Yeah, and
did anybody hear Yeah, and Sabrina, did anybody, or did you hear? I haven't had a chance to. Of course, we were up late. Now I'm studying for the Attorney General's budget hearing this morning. So I'm curious to find out if he shows up for that one. And maybe he was sick or something was wrong. That he couldn't make it in a family emergency. But I really would
ridiculous.
like to know. Did you hear anything?
This
did
is
you
a
guys
big.
hear anything at all?
Hear anything about which?
That why he did not show up?
No, I didn't hear anything.
Okay, so I didn't either. Then.
It was just these two attorneys that showed up, Jessica and Stephanie, and I don't think anybody said where or even asked where is
where
he?
they were. Yeah, exactly. Well, I guess hopefully we'll have that opportunity today when we have the budget hearing for the Attorney General's office today.
Right, unless one of your colleagues comes up with some kind of weird rule that he can't ask him anything about anything important.
And when has Tello ever followed the rule, you guys? Come on. No, I am definitely going to ask because there is a request for an opinion that I sent out to the Attorney General. And I cited a law, and I think I told you about this, you guys. I cited the law that in the event he does not provide that opinion within a certain amount of days, that he would have to pay a fine of $100 a day. Now, I cited that law, sent it to him when I asked for an opinion. He is so late right now. He's so late. So I was wondering, did he get my note? Does he understand? He sure does, because during that interview he had regarding the double pay, his opinion, there was a comment made by him saying that I have to get this to Senator Snogestein or so I'll have to pay $100. Well, then now he recognizes it. And now he's going to have to pay $100 because he failed to give me the opinion this week. So I'm going to ask him that. And frankly, I don't care
Senator,
if he rules on questions.
He's only the lawyer for the Democrats. I think you're in the wrong party if you want an opinion.
Isn't that shameful? I mean, we thought we thought by electing an Attorney General, we would have somebody who could be very honest, transparent, and unbiased, totally unbiased, by having an elected AG instead of one appointed by the governor. I think we should have two. One appointed by the people of Guam that represents the people of Guam, and then the Attorney General who she can pick whoever she wants to be an attorney. Or wait a minute, does she has high?
Yeah, you have like two or three. The Lori Tumeneg, she was there, part of the governor's legal team. Who else was there? Sophia Diaz and High.
Oh yes.
Yeah, the three people.
Between them,
and you still needed to ask the AG for guidance?
Yeah.
Yeah. Oh, absolutely.
I mean, did those guys take the procurement class? I was wondering the whole time, like, man, do we need to get John Brown in here and just do like while we got you all here, John Brown's going to do a real quick procurement primer, because obviously I don't know what kind of legal counsel doesn't know how to procure or to follow the basic
and the fact that you didn't even ask the chief procurement officer, but just CC emails.
And Senator, let me ask you, so it was clear in that this is the first real good look that we've had at the governor's legal counsel.
Absolutely.
Right? And so I know he hid behind that statement. I felt like the responses that you guys were getting were very catty, were very petty, were very confrontational, and downright disrespectful.
Yeah, Carlo Branch's statement to Jim Moylan when Jim Moylan asked about the conflict of interest, which, you know, I was hoping it would extend a little bit to provide credibility into the conflict of interest when questioning High, to get him to the point after, do you think this? Were you an attorney over at the Bank of Guam? Are you the son-in-law of the governor? You know, when you went after the Pacific Star and did the negotiation, didn't you think at that point, because of your relationship, you know, things like that, to kind of put it to a light where, but it was quickly asked, so he quickly answered with no, I don't think there was a conflict of interest. Are you kidding me? So what do we do now on this? Do we have an ethics panel that was put together?
Oh yeah, you can file a complaint with the Ethics Commission. Oh wait, yeah, no, you can't.
Who is appointed?
They don't have a budget. They don't have an office. They don't.
Yeah, but who appoints the ethics board?
Yeah, the governor.
Exactly. You know, things need to be put in order besides procurement. And Senator Sabina Paris I was getting texts like, "Oh, this is so slow. It's so dragging out." I don't think so. She was making points. Yeah. She was hitting on points that were very, very important. It might not be as fast speaking like some of us, but she was hitting the points and going down it chronologically. Yeah, exactly. And she was reading from Attorney Brown's comments too. He sent me some comments as well, and I looked at it so because procurement is very difficult and to follow along how things move. But the one thing that at the beginning, I mean, I'm guilty of it too, because I went straight in and asked a question so quickly without, dragging it on, was there payment made before a contract was signed? I mean, and it was, and I asked Bern, and there was payment before a contract was signed.
Yeah. Remember, Senator, there was
negotiate Pacific Star right after you told us at the beginning that no, you didn't. It was Mary Torres did all the negotiation. Did you negotiate it? So we've got so much that we can build on, and then go back, research. Therese Chalahi was asking excellent questions. Excellent questions.
Yeah.
So she was ready to.
If you want to talk about a lawyer, I felt like she cross-examined them guys, and they didn't know what to say after that because they were totally exposed.
Exactly. And the first question she asked that I thought was amazing was, well, who here is representing the Attorney General? Is it Stephanie or is it Law?
Yeah, because they're all representing the governor.
Yeah, exactly. So
what did you make of Assistant Attorney General Jessica Toft? Was it just me, or was there like a tone there, sassing? I don't know, or is that just how she talks? Because it seemed pretty obvious that.
I don't know. I never really met her, but I do know that she sounded irritated.
Yeah.
And it's a job that she's supposed to do, to provide this information. And it was, I think the tone kind of calmed down a little bit when Therese Chalahi started speaking. And that's so wrong. Just because I'm not a lawyer and you think I'm just some grassroots person, you can talk to me like that? Mm-hmm. No, that's wrong. She serves the people of Guam. I believe her paycheck comes from our tax-paying money.
I think that's really on display with these responses. Like, no, you don't work for the governor. Mm-hmm. You work for the people of Guam.
Exactly, and have a little bit of respect. I really, Carlo Branch, to make that comment to Jim Moylan, that he's so obsessed with the 19th floor was uncalled for. But
well, I mean, I think Carlo has zero credibility. I think that on a personal level with me, when we did this story on the deputy director that was hired over at DISID, I mean, he basically tried to BS me, and I felt like before that we had you're on that side, I'm on this side. Mm-hmm. You do what you got to do, I'll do what I got. But the minute you try and really just go in and lie, I can't even.
By the way, have you guys ever had Tim Uggan on?
No, I don't. Yeah, he's on leave apparently.
He's on leave, but you've had him on your show before or never?
No, I think we're gonna. Well, how it works is
let's get him on.
We gotta.
You have to ask Adelup.
Yeah, we gotta ask Adelup. So, and what do you think they're gonna say?
This is an area that deals with federal.
Right.
Almost 100% of the time.
Yeah.
Federal, Homeland Security, and for him to take the direction of the governor and not. Oh my gosh, no.
I think Tim Uggan is he like going to be the new Linda and Pinko Denorsi, where they're just going to say all these things for him, and then when we hear from him, it's going to be a totally different story because they are really. I don't get it. Linda herself is saying what she's saying, and you have Carlo Branch trying to say, no, that's not what she means. You had the governor saying, oh, no, she couldn't recall. Or whatever. No, I don't even.
Sabrina, did you see that part? It was priceless. I'm trying to look into the video to see where is Linda sitting with Loft.
She's sitting with Jessica Toft.
That must have been awkward.
But not just there, but where at? It's almost like they had a guard for her. Sure, she stays up. But where exactly were they sitting at? It almost looks like the governor's office over at Adelup, that they were trying to keep her under wraps. And you and I, we all know Linda. She's not going to go down for anybody.
Right.
She's going to cover her,
Right.
and cross her T's and dot her I's.
Correct.
But it was priceless when they asked Linda a question the very first time, and someone said that, "Oh, we can't hear. Can you speak up?" And then quickly, I think it was Carlo Branch, ready to speak on her back behind, and she goes, they're asking me the question.
Right.
I'm speaking.
Yeah.
Oh, that was priceless. You go, girl, Linda. You go. I'm telling you, don't let them speak for you. You cover your CYA.
Right. What are you guys going to do, Senator? Because I think it's pretty clear if you watch the hearing, like we all did, there's something's got to be done. I mean, it's clear that the people who refuse to do questionable things, they're sticking to their story. And it was all on display for us. You know, that
absolutely
that Claudia
it's all
Fauci
on the record.
Claudia Fauci said, "Why am I going to help you when you already paid people? I don't want no part of this mess."
Yes.
Linda and Pinko DeNorsi, I mean, Hike said he didn't lead Pacific Star, and Linda said, "Yes, you did."
This is
They said Mary Rhodes was involved with Pacific
And
Star.
then she said,
"No, I wasn't."
So, Senator, are these? I don't know what to call it. Are they are these lies, or are they just like being a lawyer?
Well, it sounds to me like the governor's got a lot explaining to do.
Well, you know how that works. We're
No, it doesn't.
going to get our head bit
Part.
off at the next press conference.
Well, I think no, it doesn't. The people of Guam, I'm just so proud of everyone who's been paying attention to what's really going on in this government, and they're being a part of it. They're sending in letters. They're calling your stations. They're calling senators and individuals and saying, "Wait, this is wrong. You guys need to keep pushing." And that's exactly what that needs to happen. I think those marches down at Adelup that are going on, this is great. Accountability. So I don't know what. I remember when you guys first started this radio station, radio program on the COVID-19. For the longest time, she wasn't taking phone calls. She wasn't reaching out to the public, letting people know what's going on. And it was because of the push of the people of Guam that then she comes in and has this 1 o'clock in the afternoon, well, I couldn't say 1 o'clock, but 1 o'clock, 2 o'clock, 3 o'clock press conferences because it was called out. She was called out for it. So now that we had this procurement and information that was brought up by her administration, as well as those who do not want to follow the sinking ship, to come out and say what they did, it's all exposed now. So now it's in her court. What are you going to do to rectify this? What are you going to do? It's going to take more than an apology, that's for sure.
Well, they haven't apologized. They've doubled down, they tripled down, and they're just, I use my powers, that's that.
You know, the biggest part that really gets me is that we've reached out, myself, I know I've written a couple letters to her to ask to reach out to us, to all come together and take the politics out of this. The bipartisanship,
maybe you need to be buddies with Senator Will Castro, because he looks like he's in with Adelup.
Or yeah, exactly. So I've asked him that question too. I said, "Hey, buddy, I didn't know this was going down. What's up?" So I'm just curious now what the next step is.
Yeah.
This is out in the open. There's going to be a second public hearing, and that's the one everybody should get their popcorn and their notepads.
Right.
The crazy thing is that Josh Denorio was on here and he said, "Yeah, there's all these red flags." I didn't realize it was like a whole field of red flags. Like, my God.
It was a good one, and I'm really, really happy that we went into recess. That it was not there was not a emergency hearing, which was just, I was mind boggled. Why did we even have an emergency session? And then I saw the press release last night from Senator Barnes about no delay, let's pay. Press release, and then just dogging on Truth Terlahi. And I was saying, wait a minute, why didn't you object for an adjournment, for a recess, after Senator Sinagasine requested for a recess so that we can go into? Why didn't you, object to that?
Let me ask you, Senator,
that was so political.
because I know you'll answer. Let's go way back. Do you think the whole complexion of the relationship between the legislature and the administration, and I'm saying in that they have their 6-7 innies down there that the governor snaps her finger, they jump. Do you think had the caucus selected Senator Therese Terlaia as the speaker that we would be having a totally different conversation right now?
Absolutely different conversation. I think that there would be more fairness. Definitely the way the sessions are conducted would be done more professionally, I think that everybody would probably work more harmoniously together than what's going on right now. And I definitely think that there would be that checks and balances between the branches of government.
Right.
That for sure, I think, regardless if it's a Democrat legislature and a Democrat governor, I think with Therese Terlaia behind the gavel, then I think you're going to get what the people expect us to do, and that is to be fair and go through checks and balances.
All right, Senator, we're at the top of the hour. I want to thank you for your time, definitely your perspective. We watched you at the hearing last night, and you were asking some good questions, so thank you.
Thank you so much, and thank you, Sabrina. You guys take care. Create a great day and a great weekend. Let's hope that there is and I will write a letter to Senator Sabina Paris. I did text her after the hearing and said she did a great job, and that looking forward to the next one, and let's rock and roll. Let's get this all out in the open so the people of Guam can truly see what's going on.
Thank you, Senator.
Okay.
Wash your hands.
Thank you. Will do, as always.
Be safe.
All right. 7:58. We'll take a break, and then we're going to jump on to KUAM TV 11 again. It's the KUAM News takeover of Guam's favorite containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Now is not the time for us versus them.
GMH Administrator Lillian.
University of Guam Dean of Nursing, Margaret.
There is light at the end of the tunnel.
Help is on the way from a marine medical.
Out in the public, where all are more exposed.
585 have tested positive.
Good morning, Guam. Oh, great. You know I can't dance, Reed. Hey, it's 8:09. The KUAM News Takeover at Guam's favorite. It's containing COVID. We're KUAM FM and Hagatna Guam, the show. All over the place. Thank you guys so much. As we are on KUAM.com, there's a stream on the KUAM News app, Docomo Channel 10. There's an audio stream, of course, right here on the radio, Guam's favorite, I-94. Thank you, Andy Wheeler and I-94 family, for letting us come on here on this Stay Home Live Local Fridays. Yeah, we got a great Stay Home Live Local Fridays for you guys. 6:30 on our KUAM News award-winning, Edward R. Murrow award-winning, legitimate social media networks.
You change the promo, right?
So legit.
Too legit to quit.
Amen. So that's 6:30. I know it's on the Facebook, Bree, but they can catch it in a lot of different places, right?
Yeah, on TV. We do TV, people.
Yeah, and then I believe it's also going to be streamed here on I-94 FM. And I wanted to mention that because I see my buddy Tim Balahadia on the Facebook live feed. And again, last but definitely not least, KUAM TV 11, thank you guys for joining us. And on, like I said, the Edward R. Murrow award-winning social media networks. Thank you to our Facebook Live viewers. Hey, let's go to the phones here, where we have Miss Anonymous with a question about accountability, ma'am.
Yes.
So I'm assuming you're talking about the oversight hearing last night. What was the takeaway, and what would you like to see now that that hearing is done?
Well, with all the exposure, in the end, who's going to be accountable? Any prosecution?
Well, the AG's office was present during that oversight hearing, and it was quite clear who they were representing because they had cited attorney-client privilege, and the moment that the governor's legal counsel reach out to the AG's office for guidance in all of this, that triggered that attorney-client privilege. So I really don't know.
Yeah.
I think it was Therese Terlahi who mentioned that when this had happened in the past, that a special prosecutor, a special investigator stepped in.
Right. And I didn't know AG stands for Attorney for the Governor.
I think we should call in the U.S. Attorney General.
I mean, it definitely involves federal funds.
Well, the senators and everyone else that can speak for the people should move on.
You watched the oversight, obviously. What were your thoughts when you started hearing everybody speaking and not really answering a lot of the questions, and then
It's
to hear
like watching a circus. Clowns and clowns and clowns.
Was there any part that stood out? Any part of the show?
The lies from the legal counsel for the governor. What more do we need to hear?
Do you think we should see any resignations, or do you think that's out of the question? Because Adelup, I mean, they continue to say that, hey, we had the power to do this.
I'm thinking recall. We people from Guam, we need to protest and get everyone that is not doing their job out.
But what about when you hear that, this is an unprecedented situation? They had to act fast. They had to get these quarantine facilities. Their intentions were in the right place.
Well,
and they had to do what they had to do.
What do they make the laws for? So they can break them? And that's been done with the senators. They create the laws and no one follows.
Yeah. So I wonder if I'm speeding and then I get pulled over by the officer, if I can say, no, I got to act quickly.
Exactly.
Because I'm late for work.
Common sense. All it is common sense.
Mm-hmm.
Yeah, and I think no matter how much legalese they throw out there, we're not lawyers, but we're not idiots either.
Exactly. People of Guam, stand up and protest.
Thank you, ma'am.
Thank you, too.
Wash your hands.
Be safe.
Will do.
Okay.
You too. Bye.
All right. Hold on. Let's get Jason on here.
Oh, okay. Hafaday and good morning, everybody. Good morning to you guys as well. Speaking, kind of timely how that anonymous caller was talking about protests, because there's a pretty healthy side chat going on in our comment stream right now, and Sandra Regis has been very, very active, and she's apparently is, if not the organizer of, then she's a major proponent and a promoter for protests that are going on, she said, Monday through Friday at the ITC intersection. And she was also saying that she may be starting like an online petition or something like that, and she also used the word recall. So she also is echoing the sentiments of that caller. So that apparently is an idea that's starting to gain a little bit of momentum, guys.
Right on.
Okay.
Thanks, Jay. 8:14. Well, as we always do in this part of the show, and again, it's all brought to you by Calvo Enterprises, Ambrose Inc., IT&E, Coast 360, and the Bank of Guam. We take a dive into the day's COVID-19 headlines from the KUAM News team. Sabrina Salas-Metanani, good morning.
Hafaday, good morning, everyone. On Thursday, Public Health ran 24 samples, and all of them came up negative. This means the total number of confirmed cases of COVID-19 on Guam remains at 165, with 5 deaths and 125 recoveries. As for the recent 11 positive cases, they are from the same cluster from a neighborhood in Jigo, while the other new positive, that was 10 that were from the same cluster from a neighborhood in Jigo, while the other one was not related. The 10 are asymptomatic but are believed to have come in contact with 2 previously positive cases and are now in isolation, but are not hospitalized. Public Health Director Linda DeNorsi did not provide any specifics about the 10 cases, such as if they may have been together at a gathering or even an event. The governor, meanwhile, has decided to delay the reopening of dine-in service at restaurants. Was it emergency procurement or emergency purchases? Who does the Attorney General's office represent, the people or the governor? Who's in charge during a public health emergency? The Public Health Authority, Linda N. Pingo DeNorsi, or the governor? Who's in charge of procurement for the government of Guam? The government's chief procurement officer, Claudia Ekfaji, or the governor, or her legal counsel, Hai Hyun? It was a night of contradictions in the Guam legislature. Senator Sabina Perez had called the oversight hearing to look into procurement during the pandemic. But minutes before the hearing started, Governor Lulian Guerrero invoked her executive privilege. In a letter to Oversight Chair Perez, the governor wrote that she is saddened that her public comments and private explanations regarding the quarantine facilities have not been sufficient. She added that she was not sure about the purpose of the oversight hearing, adding the issues concerning quarantine facilities have been repeatedly addressed in multiple forms. Quote, I do not have any other information to provide. The governor's legal counsel, Sophia Diaz and Hai Hyun, did show up but didn't answer a lot of questions. Hai instead read a portion of a written statement providing a chronology explaining the use of digital and wet signatures of Public Health Director Linda N. Pingo DeNorsi. According to the statement, Guam Homeland Security Advisor Tim Uggan dropped the ball, so the governor directed Hai to step in and handle the procurement. This despite the fact that that's the job of the Chief Procurement Officer for the government of Guam. Here's Claudia Ekfaji.
So in regards to the procurement of quarantine facilities, what was your involvement with that, and what was the earliest that you were involved in the procurement of those facilities?
On May 9th is when we actually GSA received a requisition from Homeland Security to procure for quarantine or the QFAC facilities.
Okay, so the fact of the matter is that the quarantine facilities were used much earlier, before May 9th. To your recollection, who was doing the procurement prior to that?
I'm not aware, Madam Chairman. I had no involvement before May 9th.
So on May 9th was the first time you had any information regarding procurement of quarantine facilities. Did it raise any flags to you that, or first of all, were you aware that quarantine facilities were being procured prior to that date?
I kept hearing, about quarantine facilities being used again through the media and everything, and I received emails from Mr. High and Tony Babauta, the former chief of staff, regarding the I guess what transpired, or trying to explain that they need some assistance in reviewing documents. But then after meeting with Mr. Lester Carlson, he mentioned that there were payments made already. So I'm like, it's a done deal. I mean, there's nothing I can do.
Because you're the chief procurement officer, you oversee the procurement for the Office of Homeland Security and Office of Civil Defense and the Office of the Governor. Why were you not taking the lead in all of this?
I believe when an emergency is executed or an executive order is issued by the governor under the emergency procurement, as is customary, we actually work hand in hand with the Office of Homeland Security. And in this case, as mentioned in Chapter 10 of the health emergency, as we were reading the executive order, it did not delineate that the governor suspended either the 5 GCA, which is the procurement statute, or the 2 GAR, the regulations, the procurement rules and regulations. And Chapter 10 did specifically say that if she was going to again, bypass all those or execute her powers, that it will be stated through an executive order. So my understanding is that we were again communicating closely with the Homeland Security Office, since in any form of emergency, that we again work through the DLAN system, so that again we're always thinking of reimbursement. Okay, and we again, based on our experience, we're familiar with what kind of procedures FEMA is looking for in terms of making sure that we meet our local procurement statutes as it relates to the procurement process.
Isn't this a cause for concern or a flag? Does raise flags as chief procurement officer? And what steps are you going to do to find that information, or what is your role in getting that information?
Again, Madam Chair, again, for my understanding, or at least my understanding, is that again, they're already at the point of invoices. So I really don't want to get into any mess that I wasn't aware of. And of course, I did raise concerns with like Mr. Chuck Davis, in regards to communicating with the Homeland and Office of Civil Defense, like traditionally I do during an emergency.
During the oversight, Carlo Branch, who was the governor's chief policy advisor, talked about the governor's Title 10 special powers backed up by the Organic Act and case law, and that it was the governor who was in charge of procurement. Meanwhile, it was made clear the AG's office was representing the governor and wouldn't answer specific questions, for example, about unsigned contracts or emergency purchases, agreements. The AG's office said when the governor's office contacted them for guidance, that kicked in attorney-client privilege, so they wouldn't answer specific questions during the oversight. The AG's office also talked about how federal law trumps local law. DOA Director Edward Byrne confirmed he made payments at the order of the governor, even despite no contracts being signed. He also admitted that payments were made even before Federal CARES Act funding was made available. As for Linda N. Pinko DeNorsi, she acknowledged that according to the same Title 10 special powers, law that Adelude keeps referring to, that she actually, as public health authority, has superpowers too, and that includes procurement. But it's something she says she was not involved with for the pandemic, and specifically the procurement of quarantine facilities. Meanwhile, according to responses to FOIA requests, more than $1.8 million has been spent, and that is as far as we know, for quarantine hotels. Additionally, following all this controversy, new contracts or another round of emergency procurement for quarantine facilities went through the proper protocols and were signed off by Claudia Ekfaji, and she confirms it took all but 7 days. Another oversight is expected to occur in the future. And speaking of contracts or agreements, apparently there is not one in place for the governor's Tier 2 clinics. These are FHP, SDA, and AMC. The governor, through an executive order, announced she's directed them to help with the pandemic. Neither of these clinics have been paid a penny. Here's more from the press conference.
Just to set the record straight,
when Chris questioned about the Tier 2
Chris,
clinics.
I pay as invoices come. I pay as bills come. And so for the hotels, we are starting to get invoices and bills, and I understand from DOA that they are paying those vendors. As far as the clinics, I have not really received any invoices from the clinics. I know that there is discussions with attorneys about the MOU and the memorandum of agreement, but to this date, I have not seen any invoices from the clinics.
Okay, so you're saying that if they give you the invoices, are you going to use your special powers to pay them right away, or?
I don't need to use special powers to pay them right away. I used my emergency service authority to purchase the services, but the payment as they come, the billing as they come in and the invoices as they come in is a responsibility of the Department of Administration, and that's part of doing business, and that's part of our operations, that's part of our obligations that we are continuously paying as we receive them.
In national news, as states start to reopen, a new study shows lives could have been saved if the government had been faster to order lockdowns. Skylar Henry reports.
The coronavirus pandemic has claimed more than 93,000 lives in the U.S. so far, but a study from Columbia University shows more than half, some 54,000 people, might have been saved if the government had imposed social distancing measures just 2 weeks earlier.
We have made incredible sacrifice. We can't let that have been made in vain and just drop our guard and go back to life as normal.
The CDC has issued guidelines on how states should reopen, but the guidance for churches has been shelved for now because the White House disagrees with the initial plans.
Why are there no guidelines for churches or things?
We are working on those. Those are actually in my inbox.
So there will be some?
Yes, they're expected to be.
President Trump is headed to Michigan this afternoon to tour a Ford factory that switched to making ventilators. Ford has asked the president to wear a mask during the tour. The president criticized Michigan's Democratic Secretary of State after she sent absentee ballot applications to voters there. He then threatened to withhold funding to the state because of voter fraud concerns.
Threatening to take money away from a state that is hurting as bad as we are right now is just scary, and I think something that is unacceptable.
Michigan says absentee ballots will allow people to vote while maintaining social distancing. Skylar Henry, CBS News, the White House.
7-1 report, the Bank of Guam announces the reopening of its Jigo branch beginning Tuesday, May 26th. Extended hours have also been announced and also begin next Tuesday. Guam branches, Hagåtña, Upper Tumon, Anderson, Mangilao, and Jigo branches, and Tumon drive-through, again 9 a.m. to 3 p.m. Monday through Friday, closed Saturday, 7:30 a.m. to 8:30 a.m. Monday through Friday for the Hagåtña branch, and drive-through Manamco hours, again closed on Saturday. And that is your Banking 671 report, brought to you by the Bank of Guam and Coast 360.
Thank you very much, Sabrina. 826. About to get the medical director for public health, Dr. Jana Maglotnia, on the show, but I wanted to play this clip from Dr. Felix Cabrera from yesterday's press conference, and he was saying and discussing the criteria that would involve a move from PCOR to PCOR. So again, this is Dr. Felix Cabrera from the Governor's Physicians Advisory Council.
What we would look at additionally is, for example, the new cases itself. So
we set an initial threshold of 5 cases in one day, but with the key part of that being a 5-day rolling average. So yes, 11 cases, it goes above that threshold, but it's important to look at it as a trend overall. So that's why, again, the 5-day rolling average is important. And in this case, it's only 2.2, so well below 5. If we see that it goes above 5 and it stays above 5 and it's trending above that, then that's one factor to take into consideration. The next part is the test positivity rate. And again, that's 3% is the threshold that we've been setting as a way to, if it goes above that, that will be a red flag. And in this case, from yesterday, it was 7.59, and the 5-day rolling average is 1.52%. So again, well below the 3% part. The other part is that it's important to understand that with this particular increase in number of cases, it's actually a good thing for an entire island that it's actually a cluster, or 10 out of the 11 is a cluster, because clusters are easier to study and control. And that's the key part. If this is 11 positives that are spread around the island, that's a whole different scenario. And that's when we may not even wait for our thresholds to be met before some other decisions have to be made. So that's the key part, I think, in this, in understanding what these 11 cases mean in context. So it's with that I would, that those 3 main factors is what we will look at before we raise even more red flags. But the key thing to understand again is, even with our histories, that what we showed was the positive cases were showing up to the hospital before we were finding them in the community. We're seeing none of that. So that's an added layer of assurance. The contact tracing team, in fact, the reason why we found these 11 positive is because of the excellent work they are doing, and they're going above and beyond. And also because we have more resources to test is why we're able to find this. So if anything, these positive cases are actually a positive thing overall, because we're finding them early, relatively speaking, compared to in the past. So we can get this under control in a much quicker and safer fashion, and rather than it can be a small little fire as opposed to a blaze, is what we would compare it to.
All right, so basically it's impossible to go back to PCOR 1. Oh, man. Hey, let's, on that note, because I know she has a good sense of humor. Good morning, Dr. Maglonia.
Good morning.
Well, it's Friday.
Okay, I'm done. Thanks.
How about them Raiders?
Yeah.
No.
49ers.
Redskins.
Redskins.
Right, yeah. Doc, just first of all, so we know that Linda discussed the cluster. Is there anything else that you can tell us about the progress that public health is making in tracking this group?
It's contained. In fact, I've got to be careful what I say, not because of public health or transparency. It's because we're small, and sometimes what we say pinpoints an exact person, and we've actually had a person even call and say, "Thanks a lot, now my family knows." And we thought we were being general, but it's small. And so when you say somebody that just got back from Barbados, there's probably one on island that just got back from Barbados, so that's the reason I'm careful. But I have to say, and of course I wear the public health hat, but if criticism is due, no problem, we'll take that. But I have to congratulate the contact tracers in this case, because there were, let me see here, did she mention this? I got to be careful I don't say overshare. There were 2 particular cases, and the information that we initially got was confined to the home, no, and I'm being real general. I wasn't involved in the conversation, but there was no big flag on the 2 cases, if that's all that's in the household, and they've been socially distancing and that sort of thing. Well, the contact tracers always want to be sure, so they made a visit, and they felt like they had better test everyone in that little area. And they did. They tested 25 people just to be cautious, and 10 no symptoms, did show positive. So, and it's only because they did that. Now they will take those 10, because we know that, gosh, how many contacts will an individual have? On a good day with no quarantine, 10 to 15 per person. Wow. So we might look at 150. And then what they will do, they keep going out. They start with the inner circle. They now identified 10. Then they expand it and go to each one of those and where have you been? What have you done? And everyone in a certain band of the circle will be quarantined. So that's how you contain it. I'll see a lot of comments where they go, oh, it's already out there, forget contact tracing. This shows exactly how valuable it is. Even if these were spread all over Island, which would have been alarming to say the least, we wouldn't have liked that. But these were all identified in an area that the flag was up. And so, and this is what they do with every case. And so it was contact tracing at its best. So now it's been contained, and they will continue and develop each one of those cases and quarantine as needed in the following days. So I don't know if that makes sense, but you don't want to see 11 cases at all. Right. But everyone's clamoring, going, oh, our machine doesn't work, we're never positive. This shows our machine does work. We've just done a great job as an island to do what we were supposed to do to stop this thing. Right. And now we're trying to balance the ship, ready for any wave that hits with incoming, that sort of thing.
Right, Doc, but how do you kind of balance not explaining away these 10 cases as a cluster? Because I'm not saying you are explaining it away, but
no, it's a cluster. Yeah. It's a cluster, and but it's gunshot from a gun can splatter, and you can have people hit with shrapnel all over the place, or you can have a little pocket where a gunman went in and shot the family, and so. If you have someone that has a motive and goes in and shoots the whole family and the whole compound, we could go on the radio and say, okay, guys, the whole island is not at risk. This was an identifiable person, and he had cause. So the whole island isn't at risk in general because of that one shooter. Whereas if you have someone just driving around shooting random, everybody better get in their houses and stay there. And that's probably not a good example, but if you this is sort of like that. Yeah. I don't know how better to say it.
But Doc, so obviously, there are people out there who are saying if we found a cluster of 10 asymptomatic COVID-19 positives, how many other ones are out there, right? That's what I think a lot of people are thinking that.
Well, we don't know, but that's why we do contact tracing, because we wouldn't have found these 10 without it. Actually, we had 11. One was from a different case, and those were all identified because of contact tracing. If we didn't do that and followed what some people in the community are saying, oh, forget it. You've got 11 people out there with 10 to 15 contacts each, and then they're 10 to 15 each. I got to tell you, it is as important as quarantine. Guam is small. This isn't New York. We're not looking at 11 million people. We still have enough people to go out and look for the shooter.
What would you say to people out there who are thinking that maybe this is a sign we need to just widen the testing criteria and catch more of these asymptomatic carriers?
We are, because we identified these as contacts. What about the ones we're not identifying as contacts? The ones where they haven't come to our attention and maybe they passed them in a store or sat with them in a movie, or, I'm just throwing things out there. That's why we're expanding our testing. We're putting out a wide blanket across the island, and with plans to do congregate settings. Today we're doing the Gura public housing and elderly housing in Talifofo. We plan to do the high-risk individuals from congregate settings, temporary workforce, homeless on 4 days next week planned. I'll let the JIC report address that, but we've got 4 days planned to target the homeless, sheltered and unsheltered. Then we're going to go we're leaving the frontliners for the last, fire department, police department, customs and quarantine, hospital workers and clinic workers. So we're doing just that, and we have so many test kits on island. So it's just great for us to have all these resources now. So There's not a shooter loose that we know of. By the way, too, it'll be interesting to see if these 10 or 11 are on the tail end of are they infectious? We don't know.
Right.
We'll know more as we check their contacts, because it could be that they didn't transmit it, because not everybody gets it. Out of the 25, only 10. So
and they were all within close contact. I know you can't say much, but yeah.
Oh, yes, I can.
Okay.
Very.
Okay.
Yes, we know where the shooter is, and we know who he shot. so 15 of those people just sailed through and just yawned and moved on. The other 10 are yawning and moving on, but they now have a label. So,
and are they in the government of Guam ISO facility? The 10?
No, they're all where you live.
Oh, good. Nice.
No, I'm joking.
Right?
I don't know where you live. No. you can breathe now.
Okay, who?
I couldn't say, but I don't think so.
Okay. Doc, have they squared up with you on your COVID differential pay? Just because you've talked about it before, the nurses, doctors within public health, have they paid you guys what you're owed?
Well, there are two categories. One's the differential pay for the hazardous pay. The other is the overtime, which was, and then a third one, the double pay. And who knows about that one? The overtime is being addressed. The director has submitted all the papers, and there's been a little back and forth because they need this and they need that, because everything about this thing is new to everybody. And we were talking among ourselves the other day. We were hearing like, oh, this didn't get signed, that didn't get signed, that sort of thing. And the funny analogy is that all of our medicines, our drugs, and potential vaccines are all under that EUA, that emergency use authority that is only granted by the FDA during health emergencies. I think that our island is also working under an EUA, because imagine, oh my gosh, we've got 300 people. Imagine 2 months ago, we got 300 people coming in. What are we going to do? No time for contract, no whatever. And the governor says, do it. Here's an MOU, open the thing, get them in there. You do a lot under EUA not really under EUA. I'm just using that as an analogy.
Right.
You do what you got to do on the spot. Now you go back to when things are getting a little more quiet. We look back and we go, okay, how do we do? We go, oh my gosh, we let this ball drop. You start with the bag. Yeah. So, we're seeing things that had we had time to process it properly, those things wouldn't have happened. And I don't even know what I'm speaking of, but I just hear snippets here and there. And
I do.
I know. And I listened to your press conference yesterday, and I thought, he really likes those Redskins. See, I don't know all of that.
Right.
And I can't even comment on
right.
that.
Yeah, we're not asking you to.
Yeah. So, I hear those things, and I can see that there are little, where you sit and go, oops, that was an oops. Things that you wouldn't have done if you had plenty of time and you weren't working in a crisis in an emergency room. If you have time to sew someone up, the scar looks a lot prettier than in a crisis.
So it sounds like you guys are definitely going to be out in the community doing the testing, Doc. And
we are.
Today, right? Telefootball?
Today, and then a tentative date, 26, 27, 28, 29, and Sunday. Different areas. And then the front lines, you will see a lot of that come as we move forward. But I want to go back one more time and emphasize, actually the shooter thing was not a bad example. If we thought we had a shooter loose on island, we would all run for the hills or run for the ocean. We don't. We have one shooter or two shooters with a motive, and so it's a good analogy. We don't all have to run for the hills. And actually, my question, too, is, did these people socially distance and wear masks? Because you got to know when you're in a compound or in a little area of group houses and everyone's feeling fine, that maybe barbecues happen. I don't know. But I have a feeling that perhaps there was a little bit of lapse in the following protocols. And we've all done it. We've all done it. I'll bet you when you all go to your back room, those masks come off. Everyone is, and I don't know that, but you take a little bit of risk when everything starts moving in the right direction. And so I'm wondering if maybe that happened a little. But you know the good news too. We have 11 cases that we identified. I wish it were still 0 and everyone's saying, oh, our testing doesn't work. I'd rather be in that scenario. But these people are fine. I mean, if they're spreading, they've been contained. They're not spreading now, even if they ever were. I mean, they may be on the tail end of their illness. Maybe they had it 2 months ago, and now they just got the little crumbs. Was a good way that you put that, Chris.
Right.
Maybe it was just crumbs. We don't know, but you know what we do? The same thing we do if it's not crumbs. Lock it down, contain it. And thank God we're in Guam and we can do that. And I'll bet you would be hard-pressed to find any other country, island, jurisdiction who has done as well as Guam.
All right. Thank you so much, Doc. We'll let you get back to work and, cheering for your Raiders.
I just, Redskins, by the way, I just need another half an hour to tell you a little bit more.
Oh, you are so awesome.
Yeah.
I've answered your questions. Now I'm going to teach you some things.
All right, Doc.
Hey, as always, thanks for having me on.
Of course.
And if there's any question I can't answer, I will always get it to you, and I'll just text you the response.
Thank you.
Okay?
Thank you. Right on.
Thank you.
Thank you, Doc.
Sure.
Okay.
Bye now.
Wash your hands. There you go. Always a great time with Dr. Maglotnia.
All of them from public health, from
Good people.
From Francis to Rachel. I love having
To
them
Linda.
on. Yeah, man.
Okay.
Coming
8:44.
here so bright and cheery. It's just a good time when they come
Okay,
on.
so we're going to get Mary Rhodes and Senator Sabina Perez on the show. Let's kick it up a notch. We'll take a little break first. 8:44. It's a KUAM News Takeover, Guam's favorite. Good morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
They should have played this last night every time a lawyer didn't answer a question. Which was like every time a lawyer was asked a question. Like, I want to be a lawyer. Damn, it looks pretty easy. You just never answer anything. Oh, attorney-client privilege. Oh, man. Good morning. 8:48. Let's get right to it. She is... I'm going to call her the corrector. Mary Rhodes.
Hi, Mary.
Have you watched that hearing yesterday? And I know you were in it, Mary, but when the governor's legal counsel, and they've been saying this, and I know you addressed it on the show.
Let me just read it first, right?
Okay,
Because this is the chronology that was in the governor's statement that Hai-Hin read, and he didn't read the whole thing, but on March 17th, 2020, he read, "It was discovered that Homeland Security Advisor had not procured quarantine or isolation facilities as previously reported. Homeland Security's reliance on condemning a certain hotel was not approved. Legal counsel was instructed to and quickly engaged with Guam Hotel and Restaurant Association, GHRA, to seek hotel properties willing to serve as quarantine sites. GHRA was later able to report that only the Days Inn, Wyndham Garden, Santa Fe, Perlis Court, and Pacific Star responded. All those facilities were ultimately utilized." So, Mary, fact or fiction?
Only part fact.
What's the percentage, Mary? 60-40?
It's 60%. Because at that time on that date, none of them had confirmed yet. So what I explained to everybody, or let me just stay on this topic. So with those 5 hotels, only Days Inn Wyndham had been contacted, and we met with once at the Homeland Security Office Advisor's office with Sophia Diaz, legal counsel Hai-Hun, and Tim Uggan, and myself met with the Days Inn and Wyndham. We also met with Cortec, but they did not agree on terms, and so those were the only meetings I was a part of. I did not participate in any other meeting with any of the hotels afterwards. And so the information GHRA collected, which is really our only role in this, is collecting information on behalf of our membership, was to provide the information back to those individuals, including the chief of staff. So the reason why I say 60% is because only Days Inn and Wyndham were collected, as well as Hotel Santa Fe. And I know that through the FOIA request, you have since received copies of the emails where I provided that via email to them. Now, with that information, what they did afterwards was continue to meet with them so that they can agree on terms, and I was not involved in any meeting outside of the initial meeting. The reason why I'm saying the other 40% are incorrect is because Pacific Star and Perlis Court didn't happen until probably even days later, if not even weeks later, with Perlis Court. And Perlis Court is not a member of GHRA, so I was nowhere affiliated, or even I wouldn't even know who to call to contact Perlis Court. Pacific Star did come online, though, by sending a request to GHRA to participate after March 19th, and we provided that information to legal counsel, Tim Uggan, and the chief of staff at the time, Tony Babauta.
Mary, it kind of seemed like they were really trying to piggyback off your credibility and GHRA and dropping that statement out there like, hey, no, GHRA was cool with all this.
Mm-hmm.
And is that what prompted you to jump into this?
Yeah,
this
how
meeting?
did that happen? Because you weren't on the original list or the list that I got that was confirmed to participate in the oversight hearing, and then all of a sudden you came on. How did that happen?
Yeah, let me tell you, Mary, when you came on, everyone was like, oh, what?
Oh, crap.
Oh,
That's the
man,
feeling I
what?
get.
Oh, look out. No, you did.
That's actually, from now on, that's the feeling I've gotten for the last 14 years I've been at GHRA every time I enter the legislature. There's like a deep exhale in breathing. And I'll tell you, even Congressman Mike Nicholas, even past Senator PJ Cruz, the OPA auditor, they would always be like, oh, Mary's here. And they literally would put me at the end because they know, I've always been lengthy and I'll provide all the details, but I don't always attend sessions. But the sessions I do attend, I am there for a purpose. Mm-hmm. And so I am choosy. I do pick which ones I am vocal on.
Yeah.
But when it comes to the tourism industry, or specifically to our role as GHRA, then I'll be there. And even though I was not invited, which is kind of odd considering that the government did reach out to engage with GHRA initially, it was interesting I was not included in that list. But I did reach out to some senators saying that I wanted to get in because I had already received an inquiry from a media person of why am I not there since I've been mentioned so many times.
Mary, we had a comment here on Facebook from Andrew. You've got a target on your back.
No, I don't think it's a target. GHRA has always played a very crucial role in the community, and nothing in that I said actually was disparaging to anybody.
Right.
I think I set the record clear, but also I also stated, quarantine did not happen just at the onset of mandatory quarantine going into effect. I very clearly stated we were already on quarantine facilities well before, in January with Linda DeNorsi.
Correct.
And we held pandemic workshops to explain quarantine and the protocols to take. It's part of our pandemic plan. So none of this anybody should be, I guess, worried about to talk about. Linda DeNorsi did speak about it quite in detail. And then I gave them the real timeline, which started in January when we started our pandemic workshops to get the hotels ready to start addressing quarantine, because the quarantine, the mandatory effect did not have to really just take place because you would have to quarantine anyway. If a tourist would have to show any signs, and public health has to come on site, whether it's a public health facility, a clinic, or a hotel, or a house.
Mary,
we would just initiate that.
I think any reasonable person who's listening to what you were saying now and listen to what you said last night, I mean, the argument from Carlo Branch and the legal counsel Hai Hun was that we didn't have a week. But like we said earlier on the show, if you were saying that we're looking at facilities since January and COVID-19 was the headline around the world, I mean, it's either A, you guys didn't act quick enough, or B, if we were looking at facilities since January, is it really our fault that you didn't do something to secure them sooner?
Yeah, well, we were following our plan, right, with public health. And I that is our responsibility during a pandemic or during an emergency, is to look at non-congregate shelter for mass shelter in place, or just any lodging concerns on how to handle it. So I think that we were doing our part in January, especially with public health and all the agencies that were involved when we held several workshops to get the private sector ready in January and in February. And we did this also part and parcel with GBB, the airport authority, all the agencies were involved. So where this became an urgent matter was when in March, the week prior to mandatory quarantine effect taking place, and this is where Senator Therese Terlahi identified that even prior to the executive order, we already started asking, okay, since we had gotten no's from all the hotels who responded to our survey, they said they would do quarantine on floors, but not necessarily the entire hotel. So we had to reach out to everybody. And only Days Inn and Wyndham at that time, and then Santa Fe came in, said yes to our direct call inquiries. But they also did not respond yes initially to our survey. We had to place calls to the hotels who didn't respond yet.
Right.
And it was always just Days Inn, Wyndham, and Santa Fe. And if you look at the way they're handled, even today with the new contract procurement that did go through GSA, it's exactly how it's always been handled, which is where Public Health, National Guard, GPD, all staff it. And that is exactly how it was set up initially. And
that's a far cry from what we saw with this first round of emergency, whatever, superpower buying, purchase, thingamabob. But
I want to
But
ask.
if you look, it was actually maintained throughout the entire period at Days Inn and Wyndham.
Do you feel, though, you provided that timeline, all of the talks about quarantine facilities as part of pandemic planning began in January, and then to see this statement and for Mr. Hyun to read it, do you feel like this was intentional in terms of trying to make it seem like GHRA was totally involved, this was legit, to kind
Well,
of...
I think in his defense, he's only referring to the time frame of where this is being questioned and also the time frame in which he got involved. He was not involved. I had never talked to Hai prior to March 16th or 17th.
Right.
He was only brought in after the fact. I had been dealing with Tim Uggan from Homeland Security. And,
what
and
happened
he
with
was Tony.
what happened with Tim Uggan? Because it kind of seems like they threw him under the bus, and it's very convenient to throw the person who's not there under the bus.
I think you're going to have to ask Tim that. I think Tim was involved from the beginning, and then it kind of fell off. But I also fell off after the initial week in the getting the mandatory quarantine facilities in order. So once we did the initial meeting, I did not have any further conversation with the hotels. It was all in the hands of those agencies and with legal counsel at that point. And so I really can't speak to those matters, but definitely Tim was involved from the very beginning and then throughout that process. And especially when you're going through procurement and for emergency, Homeland Security advisor, similar to what Charles Estevez said, it has to go through Homeland. And if you're going to work with FEMA, which I know that the Post quoted me today that, even FEMA with Office of Civil Defense, they're in the same building. And they have a lot of people who have years of experience, more than 10 years. Working with FEMA, and they're all right there in the same building.
At the end of the day, on these unsigned contracts, should it have been, because you see who's supposed to sign it? It was supposed to be Civil Defense Administrator, Civil Defense Certifying Officer, the Attorney General, the Governor, and BBMR. Should it have said Guam Homeland Security instead of Charles Estevez signing off?
Yes, it's always supposed to start off with Homeland Security during an emergency.
So even the contract.
But the challenge here in this is that it's a public health emergency, right? And that's why Homeland hasn't really been leading all of this in the way normally it should during an emergency. But I think that's where lessons learned are learned, is that regardless of public health or any kind of emergency, we always need to loop in Homeland Security and Office of Civil Defense if we're going to seek any federal reimbursement.
Right, Mary.
And that occurred the second time around.
The second time around, the right way. But
That's
I think
correct.
it's also
again, we learn.
You're right. It's also important to note that they were trying to run it through the FEMA reimbursement route, but they hit a roadblock when people were like, "I'm not signing that." Nope. And you had Claudia Kfaji saying, "I didn't want to get involved with a mess that I didn't know about." And so one of the things that just really gets to me is we see this hearing, and it's like everybody seems to know how we do the emergency procurement during an emergency, except for Adelup.
Yeah, but even at that, even when you go into a situation where, you know, she does have those Title 10 powers to get those reimbursements, you can still provide the supporting documents to see if the federal government will still be take those as allowable charges. So even if they're not willing to sign it, I think that if you provide them with that documentation and justify it, then you could still try to seek that reimbursement. And I would think that they would still, you know, if they're saying that this was authorized during an emergency, then I think they need to just continue down that path to seek that reimbursement, considering that she did have the right to execute those powers. So the fact that we're using CARES Act, at the end of the day, I think that everybody's kind of learning through this, and it was a fluid process. But regardless, I was happy to hear. I did ask one of my last questions is, you know, everybody acted in good faith. The rates were actually even reduced to an amount that I know was more acceptable with the government, and I know that the documentation has been provided since then. And so my question was, it's not just the contracts with the hotels, it's also the other vendors. Right. It's all of the services that were provided. And I know that we've gone back to the initial model with Days Inn and Wyndham and Santa Fe to include only government agencies that provide those services, like for the military with National Guard and healthcare with public health at those facilities. So I'm just wondering, you know, I asked the question if those services have all been rendered and then also paid for. And so I believe DOA confirmed that everything's been paid out. So right. If everything's been paid out and documentation has all been provided to support those payments, then I think that there should be resolution in that.
Yeah, but I'm not clear on what documents were provided, because it kind of seems like the governor so ordered Ed Byrne, who's now in this, I think it's obvious Ed Byrne is in a difficult position. I mean, he's not normally a short-tempered guy, and he was kind of short with you last night.
Yeah, he didn't want me asking him a direct question, which, you know, I can understand. You know, I'm not the one running the hearing, but right. As I said at the end, we're all taxpayers, and I think I was concerned more from the private sector side and making sure the hotels were indeed fairly compensated for the services that have already been rendered, because there are laws on Guam with regards to rendering services and the price that can be affixed to those services if there's not a contract. And that would be more expensive than the rate that they negotiated. And so that's already in Guam law, and it would put everybody in a precarious position even further if that wasn't placed in. So it was good to hear that those were provided, the payments to the outstanding invoices, but you're right. You know, the FOIA request was very interesting in the fact that they only provided the initial documentation for how it was engaged in the beginning, but it didn't include any of the documents, the subsequent documents. Right. It only helped justify how we started with the engagement. And so I contacted Bree because I want to make sure that everybody knows that we weren't contracted to handle these services as far as GHRA.
Well, is that the story of the day or what? Because yesterday at that oversight hearing, Claudia Fadi was like, "Oh, not involved." Charles Esteves was like, "Oh, not involved. Nobody asked me the right way to do it." Now you're like, "Oh, not involved." But the AG's office is like, "We shall not disclose that."
Yeah, but that's where that collaboration, and I think that's where we all need to learn that it's not about staying in our silos and not saying, "Hey, this is not my lane," or "I'm not involved." I think that we need to all take a lesson in working together. And, you know, then we won't have these kinds of problems. I think it is everybody's responsibility to get involved. If you see or hear things that are not being procured properly or handled, I mean, we were having meetings at Homeland Security all of the time at the beginning. And, you know, there was a big question of why it wasn't being run through the RAC in a normal way.
So people were talking about this as it was happening.
Yeah, so I think that it's very unfortunate that the result ended in the way it did, but I think that even when you're in those positions, especially high-level positions, you need to get involved so that you can help the process rather than at the end distance yourself from it and say, I wasn't involved, so therefore I'm not in charge.
Yeah, but I think they were concerned about exposure. I mean, from what Claudia Faggi said, if they're already paying out invoices, I mean, and it's clear that Charles Esteves didn't want to sign this because I feel they would be exposed. I mean, he seems to know the process. Yeah,
right?
So yeah, and I think that's so key is that these people didn't want anything to do with this process. And so when they ran up against that roadblock, like we've been saying, they took it out of that lane for FEMA reimbursement, and then wham bam boo went into the superpowers highway.
Yeah, and the same thing with Linda, right? I mean,
so
Linda
the way they describe it, Mary, is that they intended to use the superpowers all along, but that's not what happened. Because we followed the timeline of events. Sabrina has done a great job reporting on this procurement. And it's clear that they had tried to do it the regular way, but when the governor's legal counsel went out and negotiated all this stuff and then threw it over to Claudia Faggi's lap, and Claudia found out that there were already electronic fund transfer payments made, she basically said last night, this isn't even procurement anymore. It's a done deal.
Yeah, but I'm not referencing Claudia or Charles Esteves. I'm actually referencing between where it was already at, between the chief of staff, Tim Muggan, and legal counsel High. Right? They were always included in the beginning with Linda, and all of that information was taking place, and the discussions were being had, and the meetings were taking place with the vendors. So they were all involved in that initial process. And then it fell to the wayside. So I think that that's where those agencies, those higher ups need to work together to get the right resources in place and the protocols in place. I'm not referencing Claudia or Charles Esteves or Linda. I think that they've stood their ground, and I think, that's important, of course, because they did do their jobs. But I think that that's a lesson for really just any senior management team when you know things are happening, that you finish the process. You don't just do hands off and say, hey, I'm not going to be involved because one person's handling it or whatever. Because it's falling onto legal counsel. But really, was it his responsibility to finish that process too? So I'm just saying that all the right individuals were involved in the beginning, and I was part of that process. And then when
this was March 17th? Or do you remember?
Yes, it was started. Actually, we started with Homeland Security even a week prior. I was getting messages, I believe, March 12th already.
Was that
with regards to what did we secure?
Right, March. Okay, so let's say it's March 12th. Was that Tony Vivalta, HSA?
Tony and HSA Tim Muggan.
And not High?
No, not at all. I did not meet High in this process until after March 17th.
Okay, so
March 16th.
Okay, so it sounds like what happened was Tony Vivalta and the HSA dropped the ball, and then the governor told High to come in and help with this process, but then he needed help, so he went and asked the AG for guidance, but didn't ask Civil Defense or GSA or anybody.
Maybe he did. We don't know. I think that.
Well, no, because
we know.
It was all screwed up.
Maybe it's just inexperience, Mary. I mean, I'm pretty sure. I'm pretty sure the legal counsel never been a lawyer at this level. I mean, this is a high level. We need a high level lawyer to do these kind of things, and I think it's pretty clear. I mean.
No, it's clear. It is clear that somebody screwed this up at the beginning, right? And it sounds like it was the HSA and Tony Vivalta, and the governor she told her legal counsel to come in here and help fix this. And he did, but he didn't know necessarily what he was doing. So,
well, to be fair, I think we were getting traction, but not fast enough for them, and we needed to secure hotels in order for the mandatory quarantine to go into place.
And that's the argument, right? But again, I want to go back to proactive instead of reactive. And you said already, you guys are looking at facilities. We knew COVID-19 was a thing. And there was that discussion when we had the positive cases leading up to that day. People out here in the community were saying, why aren't we doing anything about COVID-19?
Right.
Yeah.
So did we have enough time? You said it was well, I'm not sure if you said it, but we only had such a limited time when we wanted to implement these mandatory protocols because President Duterte was like, okay, everybody out, right? Did we not have enough time to get these quarantine facilities by following the proper emergency procurement protocols? Do you feel that we did based on your experience?
I can't speak for those agencies, but certainly for in the fact that we were already looking at facilities March 12th, and then we were, we were already confirming facilities starting March 12th, and then through March 16th, we were already getting traction on 2, if not 3. Then that's really where those conversations on the contracting and the procurement should have taken place, which it seemed like it did, but it was handled differently.
Hey, did you expect to go into that hearing and have to just be setting the record straight as many times as you did? You set high straight in the beginning. Carlo Branch, the policy director of
Well,
Adelup.
I didn't know what I was setting straight because I was not privy to the first part of the hearing.
Right.
I was actually on the Economic Advisory Task Force conference call.
Yeah.
So I was a little late to it. Well, also I wasn't invited, but when I did get the call-in number from the senators, I was able to get on, and it was probably a good 40 minutes, I think, before I even spoke.
Yeah, I know.
But I did not hear their initial statements to even try to even speak to what they said.
Right.
I was just only testifying on what I knew and what I did.
Right, but in doing that, you contradicted what they had said earlier.
I didn't realize. I don't know what they said, and that wasn't the intent.
Yeah.
The intent was to provide a clear timeline and provide the information of how it happened.
Well, at least somebody provided a clear something.
So, again, we work together with the government. And so even for some people to say that, when people speak out, you have a target on your back, I don't think that that's where, honestly, we should operate from.
No, I think they're just saying that you spoke out and good for you. I don't think they mean it like, hey, watch your back. I think it's just a random Facebook comment. I think they're just saying that, hey, good job, because it's clear a lot of people weren't saying much last night, and I feel like you asked better questions than some of these senators.
Oh, gosh.
They couldn't even stick around for the whole hearing.
Some of the, I'd like to say I have a good relationship with pretty much everybody, with media as well as the senators, and even with the agencies I work with. And I work with a lot of agencies when we advocate on behalf of GHRA and the tourism industry. And even in working with Hai and Tim and everybody else and Linda, I have to say, even in what I did provide in that information, I was texting back and forth with a couple of people, and they were comfortable with what I was saying because it was the truth. And even though I still provided clarification, which might have contradicted what was stated, maybe it didn't completely contradict everything, but it was providing clarity on everything. And that's all I can do is provide, really the truth.
Man, I love how you put that, providing clarity. I call it calling out BS.
And there was that part because, was it Carlo who mentioned something about, the Theodore Roosevelt, they didn't have a contract, but they paid out people, and then you jumped in, and I was like, oh no.
Yeah, I really texted them too. I'm like, I'm sorry to jump in, but that is such an incorrect statement, and that is not correct to do also, because those are completely different terms, different environment. We shouldn't be comparing it to the quarantine with Roosevelt. But it's just not a true statement in that we did have contracts. They are different kinds of contracts than what the government has, and this is directly with the U.S. Navy and Department of Defense.
But Mary,
so they're not comparable.
Think if you hadn't have been there, Carlo Branch would have just put out that nonsense and it would have flown. So I want to thank you for being there to call out that BS.
Yeah, I'm glad too.
Yeah.
Because, I'm responsible for not just GHRA, the organization, or anything that I do personally and professionally, but, somebody has to represent private sector here. Somebody has to represent the tourism industry for the other businesses who served as vendors. And that's why I kept saying it's more than just the hotel. There were other services that were approved in this. And why are the hotels only being the ones identified in how it happened? What about the rest of the services that were offered and rendered during this time? Everything should fall under the same, scrutiny, but at the same time, the same rules in how we pay these out. And so that's why that question was really important with DAA, and I am glad that that's where it ended, because if in case this does fall under the Title 10, and that is what we're going to defend when we put it into the CARES Act or wherever, if we try to seek reimbursement for federal, then everything should fall under that umbrella, and then they just have to provide the documentation to get it supported. But it has to be all-inclusive. It can't just be about hotels. There's laundry vendors, there's meals vendors, there's improvements on hours spent by people, not just the executive people that served the cabinet members, but what about all of public health? Guam Army National Guard gets paid on this, police department, everything that was issued out. And so I think it's very important that everybody just complete the documentation, provide this all to the appropriate agencies, and move forward.
Okay.
Yeah, thank you.
Thanks, Mary.
You're welcome. I really appreciate all the time that you guys give, as well as, the other media, and I just appreciate the ones who did reach out to me, including the senators who reached out to me. I worked with, I texted, the chairwoman, Sabina Perez, as well as Therese, and Senator Chalahi and Senator Tina Munoz-Barnes, and even the speaker's staff, just to get on the call.
Right.
And so I'm so grateful that they provided the Zoom call information so that I could get online to clear the record.
Right.
Because, when we do public-private partnerships, we don't want to disparage anybody in the process, but we want to set the record clear, because we have to continue to work together. But how we get through certain situations is really more important than what ends up happening, right? So I think it's very important that everybody kind of take this as a lesson learned, and on a going forward basis, things are more clear.
Right. Thank you, Mary.
Thanks, Mary.
All right. Thank you,
Okay.
guys.
Wash your
Stay
hands.
safe.
Bye.
Okay.
Bye.
Thank you.
Wow, Mary Rhodes. I really love hearing from Mary because she just tells it how it is. And I got to say, when I got the governor's letter from the legislature about her executive powers, and why Hai and Sophia were going to virtually attend this public hearing, but just read the statement. When I read the statement, I may have got it like maybe 15 minutes before we were about to go on the news, and I had to rewrite the story based on that statement. And when I read the part about when Hai became involved, which again was, I think it was March 16th or 17th, and GHRA was mentioned, and it really did conflict with what Mary had told us in our interviews about how she was not involved with Pacific Star, and how Perlis Court was not even part of the GHRA.
Right, that's one I want to know more about, Perlis Court. How, if they're not a GHRA member, how do they even come into the conversation? And there's I don't know what kind of documentation we have on that.
No, there's an agreement.
Okay.
That was part of what the governor's office provided to Senator Sabina Perez. And in the information that they had provided her, it was a bunch of unsigned agreements. Perlis Court was one of them, and I believe that was signed by Bart Jackson. And I want to say, but it was signed on the same day. It was May 8th. That was the same day that the governor sent her memorandum citing her Title 10 authority and ordering Byrne to pay out these unsigned contracts and invoices to companies that didn't even have contracts, such as the Laundry Solutions and Capital Kitchen.
Right. On this note with the special powers, I had asked the governor yesterday during the press conference, about her special powers and about Attorney John Brown's statement provided to KUAM and then other media that the governor citing that she has these superpowers is a gross mischaracterization of what the law actually says. And so we're going to play the governor's answer to my question from yesterday.
Attorneys will have one opinion, and then you talk to another attorney and they have another opinion, and then you talk to another attorney and then you have a third opinion. And so everybody has an opinion on how they interpret the law. But when it comes down to the applicability and the reality of why these laws are made, one very, very, very important that a lot of people may not even understand is that when I, as a governor, is confronted with the safety of our community, when I am confronted with a pandemic virus that nobody knows about, that they are very uncertain about this virus, that it's an unprecedented kind of crisis. When I'm confronted with that, of course, I'm going to have laws guide me and that allow me to do what I need to do to protect our people. And the law that I was using to guide me was the Public Health Service Emergency Act. And in that provision, it allows me to suspend rules and regulations so that I am able to move personnel. I am able to use monetary resources. I am able to use facilities. I am legally authorized through this law to make purchases of services, real estate, or whatever is needed to protect the safety of our people. And that's what I did. I am not an attorney. I don't have opinions, but I am responsible for applying the tools and measures that I can to save lives and to protect our people. And that's exactly what I did. And as a result of that, we have done very excellent in terms of containing the viruses. Even though we've had this 11, I feel very confident that what we have done, the measures that we've put in, and most importantly, the support of the community is key to that. That is why we are here where we are today, Chris. So, you know this, attorneys argue all the time. I have a house full of attorneys. They argue all the time. And that's their job. Their job is to look at the law, and their job is to interpret the law. Their job is to guide, and their job is to assist people. And so I was advised and assisted by attorneys, and they have said that I have every authority to do what I did in purchasing these services in a very emergent, urgent situation. That's my reaction.
Okay, Gov. I guess I would just counter by saying, if you believe that you acted under the authority and the superpowers granted to you in the Health Emergency Powers Act, then why did you change horses in midstream and then go with this other procurement that some have called by the book? So if what you did to procure the hotels, if you think that that was legal and within your authority, why did you change your tune with the procurement of the new facilities?
So both instances, I have acted within my legal authority. The circumstances change as they do. Life is fluid. Life is dynamic. That's all I have to say.
Life is dynamic. So that was a clip from the press conference yesterday. That last part, man, my phone was blowing up when that governor put life is fluid, because it was just philosophical. And I know she was applying it to the situation. So let's go to the phones, Bree. We get the oversight on the legislative for the legislative committee on procurement. Senator Sabina Perez. Well, aren't you the talk of the island this morning, Senator?
Good morning, Chris. Good morning, Sabrina.
Good morning.
First, we just want
Did
to
you get any sleep?
Yeah.
What time did you sleep?
You know, it was really hard to be honest. Yeah, I've been preparing for this for a while, and yeah, there's so much information that came out of that oversight. I'm still trying to process it and organize and move forward from here. So I'm already introducing. I would like to introduce the bill today regarding it. And yeah, so working on that right now. But in regards to what was played, you know, I just want to be clear that, you know, procuring authority is very specific. I mean, if you think about the analogy of, you know, police officers who have the authority to arrest, not everybody can arrest. You have to be given that authority to do so. The same thing goes with procurement. And the law specifies, you know, who has the authority. And, you know, one of the things in the oversight was trying to figure out under what authority was procurement done. And in light of the evoking of the Emergency Powers Act. And so
can arrest. You have to be.
In looking at the Emergency Powers Act, there is very little mention of procuring authority. So to be able to derive that from that act, you know, it's questionable. I think, you know, also the comments about suspension of rules. Suspension is not equivalent to the authority to procure. Those are two different things. And so that's another thing that needs to be addressed. I think the other thing that came out of the oversight hearing was this idea of emergency purchases. So the fact of, as you saw in the oversight hearing yesterday, that the Attorney General could not answer the question of what is the definition of purchase. And if there isn't a definition, then the law doesn't exist. And since 1983, I believe, the governor was basically the procurement powers were taken away from the governor and was put under the legislature to define by statute, by law. And so that's what part of the thing that I was looking at is, you know, what is the authority, procuring authority, under what authority they were authorized to procure. And to me, that still needs to be looked at and addressed to make sure that it's clear, because right now there seems to be some sort of maybe perhaps misunderstanding of what the Emergency Powers Act provides as far as authority to procure. And the fact that if they're utilizing the term purchases is you know, it's very questionable. And I would like to pursue.
What is that? That sounded kind of different.
Yeah. So basically,
it wasn't a procurement; it was an emergency purchase.
And they didn't use that term until recently.
Right. So that's totally that's new to me, and it's not in the law. It does not state it in the law. There's no definition in the law. And
what about federal law?
Well, yeah. So purchasing, yeah, but when you're dealing with government funds, you have to follow procurement. There are guidelines for procurement, and you know the purchase is the act of transacting that exchange. But to have the accountability that's you know needed for the use of government funds, that procurement process, the procurement rules have to be followed.
You really seemed like you were holding back when you tried to question the Assistant Attorney General. Because it seemed like you were trying to get some answers, and it was like pulling teeth.
Yeah.
Or did you feel like she was talking like you were beneath her?
I was basically trying to get interpretation. I think that's what every lawyer should be able to provide, general interpretation, and I couldn't get a straight answer. And that, to me, that's something that, you know, if we really want to stand up procurement, there should be clear guidelines. And, you know, it should be coming from, you know, various members in the procurement network.
Right.
And especially in the you know, Office of Attorney General. And I think that's moving forward. I think we really, you know, we need to, like as Mary Rose was saying, you know, we need to get together and figure out how we're going to do this in a more of a coordinated fashion.
Mm-hmm. Why wasn't Tim Uggan invited, or was he invited to the Homeland Security Advisor to this oversight?
Yeah, so you know, I wasn't focused on him, partly because I think Charles Esteves was more in the limelight. But it wasn't. I apologize if I left out anybody, and so I do apologize to Mary Rose that she was not included. It wasn't because I was trying to omit her. It's just
Right.
yeah.
Well, we're glad you brought her on because she was like a living, breathing fact check.
Yeah, absolutely, and I would definitely highly recommend her for this panel to help reform. I mean, I think it'd be great to have her, Attorney Brown, and everybody in the GSA, all the members of the procurement family to come together and work out how to move forward and reform procurement. I think there's a lot of great expertise in our community. It's just about bringing them together and. My commitment is to that, to make some change.
I thought you were very methodical in your approach. I totally saw what you were doing, and I got to admit, there was a stretch in there where before the hearing, I just wasn't confident that you were going to get the people sat down in front of you that you could ask the questions to. So I guess first thing I want to get from you is your reaction to the office of the governor, the letter that they'd sent. And I know you've probably seen it now. You indicated during the oversight hearing that you didn't have a copy of it. But the tone of this letter from the governor, where she said that she would not be waiving her executive privilege, and she also had said, I'm not sure what the purpose of this hearing is. I've already talked about this so many times in the public, in the media, all the information's out there. Why do we got to be questioned? I mean, that was pretty much the tone of it. And then to go into this hearing, were you blindsided at all when you tried to ask the governor's legal counsel, Attorney Hai Hun, some questions, and he said, I provided a statement, and I'm just going to read this statement.
Yeah, well, to be honest, I didn't expect he was coming, so that was a pleasant surprise that they were able to come. And so, yeah, to have that statement sent right before the oversight, I was in transition, and so I wasn't aware. I guess it was glad that they were there, but I guess that in some ways, I feel that in response to the statements, I think I feel like we need to communicate better. That. Basically, I think that procurement law needs to be followed.
Okay, so was procurement law followed with the procurement or emergency purchase or whatever this was with the initial round of the quarantine facilities?
Well, I think I feel like we're in regards to that. I feel that they're speaking in terms of an Emergency Powers Act, and I'm speaking in terms of procurement law, and so we're not communicating in that way. But and so their interpretation is saying we have all the procurement authority under Emergency Powers Act.
But there was something that you brought up though towards the end, and that was with Linda and Pinko DeNorsi. I think it was you about that Emergency Powers Act, that the Public Health Authority would be Public Health Director Linda and Pinko DeNorsi, that she should be in charge of this, and that procurement authority would fall under her.
Yeah, I think that's where the miscommunication is that they're holding all their power on that act. And I think, I'm saying, no, that's not it. You have to follow procurement law. So I feel there has to be, some sort of meeting of the minds on, how these two acts interact. And the idea that purchases is not defined, I think that needs to be questioned. And again, it's like she said, every lawyer has their own interpretation. Unfortunately, we're not coming together on a common ground, and I think that needs to be really worked out.
But isn't it kind of surprising that we argue that there are these two acts that are in the air, this one law and this one law, but when the second round comes along to procure these these quarantine facilities, we're doing what we all thought you should have been doing in the beginning.
Right.
Right. And that's what the federal, you have a good point, because the federal law states that you have to follow local law. And so this whole idea of emergency purchases is not, it's not defined.
They just made it up? Are you saying they just kind of...
So, I'm just saying it's not properly defined. Well, yeah, from my look of things, it's not defined. So it's not, there's no statutory authority involved in that. So, but I think that's where the problem lies, is if federal law is requiring local law to be followed, and then you have this interpretation that this Emergency Powers Act is giving you the authority, are we willing to risk losing federal dollars if there is an issue about the procurement authority under the Emergency Powers Act? So I think, to play it conservatively, I think it's best to follow Chapter 5, which is the procurement law, versus trying to create this new system that is not well defined.
Yeah.
I think just in being more, and also accountability. Like, we have this law that's been in existence longer than the Emergency Powers Act, and it's been utilized, and more people know how to use it. Why can't we just rely on that?
Mm-hmm. Why wasn't attorney
with the little tweaks, right? Perhaps wherever the federal law and the local law don't match, let's figure out a way how we can make those two a little bit more aligned. So I mean, to me that seems like the logical choice, rather than to rely on the Emergency Powers Act, which is not defined as far as procurement authority, or not well defined.
Why wasn't the Attorney General there, leaving Camacho?
So I would have to check in with my office what the response was, but yeah, I can't say.
Were you surprised that with I know you started off your questioning, you wanted to get questions from Jessica Toft, but then she said she was protected by the attorney-client privilege. Were you anticipating that, or did you really think that you were going to get answers, or did you even know that the AG's office was representing the governor?
Yeah, I was aware of the client-attorney privilege. I guess in hindsight, I could have required that, or asked that they basically waive that.
Right.
And I think, I was hoping to get at least answers regarding general interpretation to laws. I mean,
yeah, that was just.
Practice it.
I felt like they were disrespecting you and the senators and I don't know. I hate to say I'm not a lawyer, but I'm not. But I feel like they were overusing the attorney-client privilege thing. And I felt like it was their tone was almost adversarial.
Yeah, it's basically, it definitely undermines the oversight, because we're trying to fact find, right? We're trying to get to the matter and understand what happened and how we can move forward. So, and to also give the public some confidence about the system. And, from what I could see, the procurement system, there was a breakdown. And perhaps it's, obviously people are working, there's no coordinated, plan. I mean, that's the other thing that needs to be addressed is under the Emergency Powers Act, there has to be a commission, which hasn't been, I'm not aware of any reports or updates to it, but I feel that we've kind of deviated from the purpose and the what was prescribed by the Emergency Powers Act.
Who was in charge? I know you were asking this question quite a few times last night. So at the end of this oversight hearing, who do you believe was in charge of this emergency procurement or emergency purchases?
Well, I mean, if you hear the testimony from Director DeNorcy, she was basically in charge with her own agency. So that's a very good question, is who is in charge. And
did you get that answer? Do you feel like after it was done, you got that answer?
Basically, it doesn't seem very, it doesn't seem like there is one point person from what I could tell.
Right,
or at least there wasn't, if there was, it should have been more coordinated.
Right, but what did you make of the legal counsel? What did he say, Bree? It was something like, I don't know if you would call me the lead on it, but then Linda Pinko DeNorcy had said when she was asked that Attorney Hai Hun, the governor's legal counsel, was in charge. Those were her words, I believe, where he was in charge of it. And
yeah.
we've all read the same email, Senator. I mean, a lot of them are coming from the governor's legal counsel. So I wasn't sure if he was trying to like step away from it. It seemed like nobody wanted to be involved with this, and then it was like not involved attorney-client privilege. I mean, it was
seemed
like
like
3
though
hours.
that he became involved after the HSA and the COS. I'm not sure what they did,
Yeah,
but he
but-
came in after.
I just want to say, Bree, that he was clearly contradicted several times in that hearing. So for him to throw the former chief of staff Tony Babauta and Tim Uggan under the bus, I would want to find out what they have to say about it. Because if this guy was contradicted by Mary Rhodes, he was contradicted by Linda and Pinko DeNorsi, I wonder what Tony Babauta and Tim Uggan are going to have to say. But, Tim Uggan's on leave, and
And Tony resigned.
yeah.
Yeah, that was a little bit.
Did you
frustrating.
get that interpretation that Tim Uggan had dropped the ball based on that statement?
I would like to follow up any questions to him without him being present. I can't say I can't make any determination on that.
Mhm.
But in regards to the lead, I think it's really unfortunate that with Linda DeNorsi's testimony that she can't even get funds certified for her own project. And what's the whole point of the Emergency Health Powers Act is to ensure that you have this lead person directing, the response in a way and to address the pandemic. And so I think that's one of the issues with the procurement is it's in disarray in a way that it's not really, focusing on, the needs as she sees it. So that's one of the things that I would like to address is, how do we reorganize this network to ensure that the emergency powers is held up in addition to the procurement law.
Right. But Senator, I mean, when I asked the governor yesterday if she was going to use her emergency superpowers to pay the clinics, she said she doesn't have to. And I think it's clear that now that we're doing things by the book, I'm wondering, are they even going to use those superpowers anymore? Because like you said, the whole process is questionable at best. And so they've, to me, in my opinion, by posting those memorandums, by ordering Ed Byrne to pay the people, I believe that they've closed the book on the usage of the emergency special powers, because this is a Pandora's box that they're just trying to stuff everything back into right now. And you guys at the legislature are trying to flip the lid off.
Yeah, I need to get more information on that. But I feel that this is just one aspect. The quarantine facilities is just one aspect. It was meant to be as a case study to look at the broader impact. So apparently there is more to uncover. And I think more importantly, it's like how, I guess that's the problem. When you use a law that is not well defined for procurement, you're going to run into problems with procurement.
So you mentioned when we first started this interview that you were planning to introduce a bill today. What exactly is this bill about?
Well, I would like to get basically it's an amendment of procurement law that so there's an advisory council and just having the members from the oversight to work together. Of course, this doesn't have to be legislated. It could be done immediately, but I would like to, in the long term, I think procurement is not going to be fixed right away. I mean, unless we put all our efforts. But I know there is a deadline in regards to these federal funds. I think there's a deadline, or it expires by the end of this year. But I think the sooner that we can get, these minds together, would highly recommend Mary Rhodes, Attorney Brown, to be a part of this panel, this advisory council, along with the other officials associated with procurement from the OPA, Attorney General, Chief Procurement Officer, DPW. So all these need to come together and bring their what they have to offer. Because I was really impressed with Mary Rhodes' testimony yesterday the fact that she knows federal contracting. And considering that a lot of these federal funds are being used, it'd be great to have her and her wealth of knowledge to be on this council.
What about the AG's office? They seem to be fully aware of federal laws. That was kind of expressed.
Yep, they're already in the law. They're part of it. Yeah, and they are part of the procurement regime.
Right.
For GovGuam.
Senator, so we've had the first oversight. I know you had indicated that you might want to do another one. First of all, is that a reality, or are you still figuring that out?
Yeah, I would like to move on, focus on the positive of change, reform. I would like to focus on reforming, and if need be, we can have more either info briefings, perhaps, or if an oversight is needed. I'm open to keeping this momentum going.
Right. Do you feel like we need to get Tim Uggan down there in the Zoom at the legislature to answer questions?
I would right at this time. I perhaps I can send him an email posing questions. Yeah, that might be the quicker way.
Hey,
considering I might be bumped again.
I want to ask you, Senator Theresa Law, you had a line of questioning that I thought was crucial when she had brought up the conflict of interest now that the Attorney General's office is going to have, and the wild chance, some might say the unrealistic chance, that they're going to review this process like their job is supposed to be. There was so much. It was so interesting to me that Assistant Attorney General Jessica Toft was just hell-bent on protecting this attorney-client privilege. And I was like, wait a minute, aren't you guys supposed to figure out what's legal and what's not legal? Or are you just the governor's attorney? Because I thought that was your job, was to be independent, impartial, a check and balance. So
and that's something that's interesting to see. I think, everybody in this procurement process could have done something, right? They were in the know to some extent. And that's, what are the checks and balances? And, perhaps maybe is there something that we need to change to ensure their checks and balances are there? And so that's why the oversight is important. This is part of the checks and balances of the whole procurement system. But, if it could have been addressed much sooner, if there was some sort of checks and balances much earlier, that's more, that's preferable. Yeah. So I think, that's an important question that needs to be addressed, is what needs to be done to ensure that there's proper checks and balances.
Right.
If you are involved in this procurement, but then who's going to be monitoring it and ensuring that there is, the process is followed in a way and properly. Yeah, and I really want to give credit because, with checks and balances, I think that the classified employees who were involved with this process, and even the unclassified ones like Linda, they stuck to their guns. And I feel like they, in a way, were like a check and balance, because they said, we're not going to sign it. And that's a big part of why we're here today. So I kind of want to recognize them, because I'm pretty sure they were under some pressure to just rubber stamp this stuff, and they didn't do it. And I think that, again, that really needs to be recognized in all this, is that we have people who it's their job to do these kind of things. Mm-hmm. And when it was brought to them from an outside lane, they said, no, we're not going to, no, that's so key here. Right. Yeah. Definitely. Kudos to Linda DeNorsi for that and all that she's been doing. It's a Herculean task that what she's accomplishing right now. So I definitely kudos to her. Yeah, especially having to deal with all this political nonsense like Tony Babauta spending the night at PacStar or Digital Signature. It's really unfair, because Linda is the public health authority leading the COVID-19, and they keep involving her and besmirching her with all this stuff, and then she's got to take time off of fighting COVID-19 to answer the media's questions about the use of her digital signature, to answer the media's questions about the procurement process. And I think it's rather unfortunate that whatever is going on at Adelup reaches to her, and she's got to be dragged down into this. And I feel like everything that she's said on the record, it's been consistent. I told her, hey, good job at the hearing. She said, Chris, I just told the truth.
And you had one point where, like, the policy director, Carlo Branch, tried to interrupt and speak for her, which I thought was pretty interesting because it seems like everybody wants to speak for Linda, but Linda's saying what she says, and she continues to say the same thing. Well, Senator, anything else in closing you want to add here?
Yeah, I just thank you for this opportunity. I think, I would like to basically extend, maybe perhaps, engage the, perhaps if we can convene convene the advisory council. I would recommend convening the advisory council, as soon as possible to kind of work through these issues. And I do hope to can continue the conversation so that we can move forward.
Right.
Right.
Okay, well, keep us posted
Thanks,
on
Senator.
your bill and any other developments. If you get Tim Uggan to answer his phone while he's on leave, let us know, because we definitely want to hear what he has to say.
All right. Thank you so much.
Thank you, Senator.
Thank you.
Have a great day.
Wash your hands. At 9:53. Hey, we're going to take a break, and it is Friday. So we're going to end this week on a good note. That's coming up right here on Containing COVID, the KUAM News Takeover of Guam's favorite Good Morning.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
And so really ready to end this week on a good note, a great note. I want to, we'll bring her on in a sec, but an Ukadu High School graduate getting a Merit Sports Scholarship to a Division I school, Mount St. Mary's University, going to play rugby. So we want to bring Regina and Sienna Nedlick onto the show. Good morning.
Good morning. Congratulations.
Hi, thank you.
Sienna, I guess just first of all, like Sabrina said, congratulations. This is huge. I'm a public school product myself, so it's great to see a Bulldog going all the way over to Maryland to play Division I rugby. Just take us from the beginning. How did this happen?
It actually happened when I was emailing all the schools that I was interested in, and I had remembered that my former teammate, who was my captain for the rugby team, which was Mara Tamayo, she's attending there right now at Mount St. Mary's University, and then I wanted to apply for that school as well. Then sooner or later, I showed my highlight rugby video, and then she replied back, and then that's how it all started. My Coach Farrell, who's coaching the Mount St. Mary's, she got back to me and she wanted to talk more, and that's how it all started.
How long you been playing rugby? Since middle school?
I've been playing rugby since middle school, my 8th grade year, and then I wanted to pursue that for freshman to senior year.
Tell us your reaction when you found out that you got the scholarship.
I was shocked. I was really shocked because I wasn't expecting it at all. Like, I did work for it as well, but I was shocked and happy about it.
Mm-hmm. Rugby is a really physical sport. How did you... What did you like about, like, because you really get banged up.
What's wrong with you, girl? Rugby?
Yeah, I mean, I went not trained, but I practiced with the Guam rugby team, the girls, and they knocked me out. And it hurt.
Yeah, it's actually a funny story because my mom never really liked rugby because of how like physical and dangerous it can be, knowing that now all her children are playing it, coming down from my oldest sibling to the youngest, which is me. We all play it now, so it's a funny story, but it's a cool thing because now all of us have one thing in common and we all play rugby, so I followed after their steps.
That's so cool. I wanna talk about you being of Kashrian descent, and from what we know, are we talking to the first Kashrian to get signed to a Division I school to play rugby, or what?
Yes, I am the first Kashrian, I believe, to be signing to the school for the Division I.
What does that mean to you?
It's very honoring. I'm a proud Micronesian, actually.
Is that your mom in the background?
Yeah,
she must be super proud.
Yeah.
She's gonna be going to those Kashrian community meetings like, hey, that's my girl.
Yep.
Yeah, she's cheering in the back, looking at me right now.
Yeah, let's get your mom in here and we'll close it out with you guys. I know, needless to say, proud mom status.
Yes, very much. I'm very proud of Tiana. And she's right. I was very terrified of rugby. And Sabrina, I actually watched your story when you practiced with the national team. And it can get pretty intense, but I don't know. These kids are they're thick-skinned and they're very determined, and just for her to take it another level to collegiate level, I'm terrified. But I'm terrified, but I know that she will do her best because she's had great support and great training and dedication, and her siblings have been wonderful role model for her.
Nice. Nana, we gotta close this out, but I want to give you a chance to give a message. But I think this is just so huge, especially coming from someone in the public school system. They get signed to Division I school. That's just amazing. So, Nan, what's your message to all the kids out there who are striving to get this same opportunity that you got?
I just wanted to tell all the younger athletes that I wanted to let them know that if there's a way, then there's a will. Like, no one's stopping you. There's okay, yeah, I just wanted to tell them that, don't give up. Like, it's a very honorable feeling coming from Guam and representing the island. So, yeah, don't give up. Do your best.
Okay.
All right.
Congratulations.
Man, getting kind of choked up over here thinking about it, but yes, congratulations. And we just want to say this is a great way to end the show on a good note. And you guys are COVID heroes to us, so thank you.
Thank you. Thank you very much, guys.
God bless you, and keep in touch. Make sure you don't forget us when you go off to Maryland, Kay.
Of course. Gonna represent the island.
All right.
All right. Good luck and God bless you guys.
Have a good weekend.
And wash your hands.
Thank you. Thank you.
Okay. Sad, Joss. Hey, 10:05. Sabrina, great job today.
Great job. Christopher, Jason.
Joe, sir. Jason, you want to put your handsome face out there for the ladies one last time?
No. Can we begin our 3-day weekend on a good? Speaking of good, let's begin our 3-day weekend on a positive note. Hey, I'll see you guys on Tuesday.
Yeah.
Whatever. Well, see you on Monday.
Yeah.
I think we're both working.
Yeah, we're working.
Yeah. Okay. So
he's like, I ain't working.
I ain't working. 10:06. Thank you guys so much. KUAM TV 11, and especially on our award-winning, totally legitimate social media networks. Thank you guys for watching. Have a great weekend. Be safe. Remember,
be safe.
A lot of us are. I'm staying home. I'm still not going anywhere. People call me like, "Hey, what are you doing?" I'm like, "I'm still in P-Corps 1."
Yeah, I don't go anywhere.
My house,
except for to get supplies.
Right, we're in P-Corps 1. Okay, so be safe. God bless you guys. Sabrina.
Yes.
Good job again, and
Good
it's
job.
always a pleasure working with you. My name is Chris. Hasta, adios.
Bye.